Good evening, Barbadians. I'm here again this evening to give you another update on the COVID-19 situation in Barbados and how we are managing it. This evening we have a special update for you in which there will be presentations by the Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostic, by the Chief Medical Officer, and by the Minister of Home Affairs, Mr. Wilfred Abrams. In addition, the Prime Minister will address you. After that, we will take questions from a wider audience through CBC and Starcom. The last update was 2 days ago, and I believe it is fair to say, and this will be borne out by the presentations from the Ministry of Health, that our situation seems to be stabilizing somewhat. In addition, we have continued the contact tracing. The response from persons to the various ads and the information put out there has been overwhelming in terms of those persons who thought that they might have come into contact with someone coming out to be tested. And this is a good thing indeed. It has put a lot of pressure on our polyclinics and also in terms of our lab having to work continuously. But it is all for the good and in terms of establishing the true numbers of COVID in Barbados. In addition, when I spoke to you last time, I spoke in terms of the prison situation, and the Minister of Home Affairs will certainly update you in terms of the progress made there in terms of isolation and quarantine of patients, and in terms of provisions being made to facilitate them being accommodated there with COVID. So without much more of an introduction, I'm going to call on the Minister of Health and Wellness, Lieutenant Jeffrey Bostic, to update you in terms of what has transpired since I last spoke to you as it relates directly to COVID and the situation with that. Thank you.
Good evening, Barbadians, ladies and gentlemen. I can report that today we are in a better place than we were yesterday or the day before. And we are in a better place as a result of the excellent work that has been done and continues to be done by the hardworking staff at the Best Dos Santos Laboratory and those who are working in the field doing the contact tracing, as well as those who have been spending significant amount of time swabbing persons so that the samples can reach the lab. As a result of this collective effort and also the response by Barbadians through the PSA that was on the radio a couple of days ago, we have been able to make significant strides in terms of the contacting of persons who we have been able to link to some of the cases that we've had. We've also been able to do most of the testing for those contacts with some mopping up work that is still to be done. I'm happy that as a result of that, we are beginning to see some patterns in what we're doing. We are beginning to see some light at the end of the tunnel. We're beginning to see where we have to be more aggressive, and given the figures that we have, and the Chief Medical Officer will go into those details, we believe that there's some hope and that we are wrestling with this in a way that would allow us to be able to deal with it in a couple of weeks. It is not over. There's still a lot of work to be done, and I give the assurance that the staff of the Ministry of Health and Wellness will continue to work day in, day out, throughout the night even, to be able to do what has to be done. We are confident that we are making the right choices at this point in terms of how we are tackling the problem, and we will continue to ask the people of Barbados to give us your support, recognize the difficulty that we face, assist us in trying to deal with some of the issues, and collectively we will get through this problem together. And so I will now call on the Chief Medical Officer who will give you some details as to what we've been doing. Dr. George.
You so much. Good afternoon, good evening, all. On the 31st of December 2020, we reported a total of 395 positive cases on our dashboard. For the first and the second, there have been an additional 211 cases, bringing the total effective the 2nd of January 2021 to 606 cases, of which 246 were female, 360 were male, age ranges 1 to 95, and there were over 72,500 tests done by the Best DeSantis laboratory. In isolation, there are 243 persons, broken down as follows: 122 as inmates from the prison, 121 from Harrison's Point, 10 in some villas, and another 32 which are currently being assessed, clinically assessed by the team. That gives a total of 275. In all, there have been 324 recoveries, and unfortunately, we have had 7 deaths. As many of you know, we have had good cooperation from the public. As many of you might have seen some of the lines in front of the polyclinics, and this is testimony to the effect that Barbadians are really willing and able to identify themselves as either primary and sometimes secondary contacts, and we have tried to accommodate all of you. This will continue. The first set of testing at the Her Majesty's Prison has been complete, and we indicated that after 5 days, all persons who tested negative will be tested again. Those persons who tested positive will be placed in clinical care. Most of the officers to date have been transferred to Harrison's Point, and the prisoners will remain at Dodds. And we have put systems in place, which we could discuss later, to make sure that the clinical situation within the confines of the prison are maintained. As you know, it has been a difficult time for us, but the team is willing and able, and this will pass also. There are a few clusters that we are currently investigating. I will be able to give some additional information. Those clusters are being contact traced, and that is an ongoing process. We are actually working towards identifying the index case, and we will have some more information to this effect as we go further into our investigations. We will continue to work with the protocols, ensuring that everyone is tested on their second test, at least 5 complete days apart, to ensure that it is clear that everyone in Barbados to be released from quarantine will have 2 tests. Today we got the cooperation of the Barbados Hotel and Tourism Association, and all guests arriving from high-risk properties in Barbados will be required to stay in their rooms until they complete their quarantine before they are allowed. And I will be willing during the question time to answer any questions that I can. Thank you so much.
Thank you, Minister Bostic and Dr. Kenneth George. I'm now going to ask the Minister of Home Affairs, but before I do that, I just want to inform those of you who are watching or listening to this program or this presentation that later on, as we have a special session in terms of participation of those who want to call in, I want to say that at that time, after the Prime Minister's presentation later this evening, those of you, we will no longer have the services here in terms of Bonnie, who would be signing for the hearing impaired. And those of you would be able to, who want to continue, can enable the closed captions on your system if required. I now ask the Honourable Wilford Abrams to speak to you in terms of what has been taking place at the prisons as it relates to this entire process related to the COVID upsurge. Thank you.
Good night, Barbados. The situation at the prison remains basically fluid, but under complete control. The officers, staff, and inmates at HMP Dodds over the last couple of days have continued to work together to manage the outbreak of COVID-19 at the prison. All members of staff, as well as the entire inmate population, were tested, and the results continue to be processed. The process of separating positive and negative persons continues as well as the continued care and treatment of all individuals. There are currently 49 members of staff and 121 members of the inmate population who've tested positive for COVID-19. And the lockdown is a mitigation against the COVID-19 spread. With respect to the current operations, we've had the unenviable position where the top 5 in the prison, the top 5 officers in prison, are not at the site of the prison because they're either in quarantine or isolation. And the operational control of the prison has been passed to Major Cedric Proverbs from the Barbados Defence Force, who has been seconded from the BDF to the prison in the position of Assistant Superintendent of Prisons. So security operations continue at the prisons with a combined effort of prison staff, members of the Defence Force, and members of the Royal Barbados Police Force. And I want to thank the BDF and the police force for stepping up to assist us in managing the staff complement at the prison. I keep getting calls and questions as to if there's unrest at the prison. There is no unrest at the prison. The situation at the prison is under control. There have been no reported incidents at the prison that should cause concern to anyone. I just want to make that very, very clear, because just before I came, I got a message from a reporter asking me about that. The situation at the prison and the integrity of the security of Her Majesty's Prison, Dodds, is entirely under control. Granted, it is not an ideal situation. The only essential services are now being provided at the prison. So provision has been made to ensure adequate supply of food to all prisoners and staff, with the meals for inmates being prepared at the school meals department, while the meals for staff are being prepared at the Defence Force. The laundry has been maintained with more frequent washing, and while the medical staff has been reduced, we are still able at this point to treat and medicate all the inmate and staff populations that require it. The reality is the prison was not built to house over 100 staff normally. So what normally happens is shifts come in, when your shift is over, you go home. But because we have an emergency situation where there's no one in, no one out, what we have to do is house all the staff that are there and manage the shift rotations. So the BDF comes in to complement this, the police force comes in to complement this. But obviously, we do not have, I would say, comfortable accommodation arrangements, because it was never built to accommodate that. We've constructed tents and done other emergency procedures to make it as livable as possible. And we're doing the best we can in these situations. It's not comfortable living, but this is not a comfortable situation. And we're doing the best that we can to maintain some degree of normalcy at the prison. Now, further testing for those at the prison is going to commence tomorrow. And that's when we start the round of second tests at the prison. The stats for the prison were given so far by Dr. George, but I will say, in response to a question I got as well, there have been no positives so far with the female population of Her Majesty's Prison Dodds. So all of those who have been asking questions about your female family, we have no positive tests so far in relation to any in the female population. At the end of the day, the safety and security of Her Majesty's Prison Dodds is our ultimate concern. We are concerned about the inmates who do not choose to be there. They're in our custody and our care, and we are managing with them as best we can. We are concerned about our staff. We are concerned about the people who have tested positive. We are concerned about the people who are waiting for their results. And we are doing the best we can to manage the situation. And I must say, not wood, it has been managed adequately up to this point in time. So I just want those who are concerned about their loved ones, who they have not been hearing from, the situation. There's also concern that there's a lack of Wi-Fi at the prison, but you must understand the prison is a secure facility. So we have to be careful about communications in and communications out. We're trying our best to allow people to contact through the phone their loved ones and their relatives, but it is essential contact at this point only. So that is the update with respect to the prison. And I just feel free to contact us, those who have been contacting us and asking about specific people, and we're going to do our best, as we have been doing, to answer and address your concerns so that you can feel comfortable that your family, that your friends, that your loved ones are in as good a situation as they can be, and at least you can get a realistic and real-time update on their on their condition. So I thank you, and I'll be available to answer any specific questions later.
So you've heard in terms of presentations from the Ministry of Health and the Ministry of Home Affairs. You've heard in terms of the increased testing that we tested over 1,400 samples yesterday in terms of swabs taken, and indeed over 1,100 on the day before. You've heard that the results are now, in terms of the positive results, are stabilizing for us, and certainly not like at the stage when I spoke to you last, when I spoke of an escalating situation. Certainly the situation has dampened and has stabilized. In addition, you would have heard over the past 2 days in terms, and certainly on CBC, in terms of the plans to introduce the bracelet, which would assist in terms of the monitoring of those who are in quarantine to ensure that they remain in quarantine. And I dare say we, in terms of the, as we go on, later on, we will hear more about the plans in terms of quarantine. The Harrison's Point facility, contrary to popular opinion, or certainly in terms of the social media, which has been giddy in some respects in terms of what is happening, I saw on social media last evening that this Harrison's Point was full, and this is indeed not so. It has a capacity of 222 beds at this point in time, and the last time I heard, I believe, it was far short of that in terms of the numbers being accommodated there. In addition, in terms of the prison, we've made tours, and in conjunction with the Ministry of Health and Wellness, provision has been made to provide, to accommodate the persons who require to be isolated. And indeed, we've gone a step further in terms of preparing the medical wing of that institute, of the prison, in terms of if we have to deal with any prisoners who might become seriously ill or might deteriorate, so that they can be managed up there. We've been making provisions in terms of having 1 or 2 ventilators there just in case they might become necessary to use them. So all in all, we have made a number of efforts in terms of dealing with this process. It has a number of moving parts, and I think all of you would be appreciative of this. I now am going to have the pleasure of inviting the Prime Minister, the Honourable Mayor Amma Motley, to address you in terms of her perspective, in terms of the COVID situation in Barbados, the management and plans to control it. Thank you. Prime Minister.
Thank you very much, Minister Walcott. Good evening, Barbadians. First of all, let me thank you for allowing us to come into your homes and to be able to speak to you again. The reality is that we have, as you've heard from Ministers Walcott and Bostic, been able to see some dampening of the difficult situation that we had. We are still very much on guard and very much dealing with the challenges, but we are in a far better position tonight than we were 2 nights, 3 nights ago. I want first, therefore, of all to thank the people of this country for your continued support, for your continued interaction, for your continued activities of helping the government stay on its toes as well as helping everyone else stay on their toes. I want to thank the workers and the employees who have willingly and preemptively taken action, recognizing that they may have been in some way or another at risk, but not sure what is the extent of that risk. In the circumstances, we therefore are buoyed by the fact that we can turn the corner, but we are not in any way going to ease our attention or indeed our surveillance of what is going on. As a result of the situation, there are a few things that I'd like to just address very quickly, because I really do want to spend the majority of time this evening answering the questions of Barbadians through CBC and VOB who have kindly cooperated to facilitate persons being able to ask questions. The first thing that I want to say in respect to the additional measures is that we still are asking Barbadians beyond the bank holiday tomorrow to, wherever possible, we've spoken in the public sector and in the private sector, where you can work from home, we are asking you please to do the remote work from home. We are asking those employers and employees to consult with one another. And this is not new to us. Many of you were already working from home earlier in the year, and therefore we can go back into those modalities at least until the 14th of January, and we will review then as to whether we need to extend beyond. Those who clearly cannot work from home because you are working in areas of activity that require face-to-face, whether it is construction sites, supermarkets, etc., we have all put protocols in place, and we are satisfied that those protocols have been working. Indeed, they have not been at the center of any of the breaches or any of the contact tracing, and therefore we would continue to urge those persons. Early on in the pandemic, I would have said to the most vulnerable in the population that please take precautions. And I say it again to you tonight. If you are in that highly vulnerable group over 70, for now, just stay home. Just take it easy. Let us get through at least, as I said, the first line of for us to check is the 14th of January, and thereafter we'll determine whether we need to extend it beyond. But thus far, the high level of compliance on the part of Barbadians has been extremely heartwarming and extremely capable of allowing us to start to deal with this situation. Similarly, we had issued a document on the 6th of June 2020 called Guidance for Addressing the Risk for Severe COVID-19 in Relation to Employment in Barbados. That document made it clear, and it had different tiers of stage 3A, 3B, 3C, 3A being less than 20 cases per week, 3B being 20 to 35, and 3C being more than 35 cases per week. We have clearly entered the stage of 3C. And what that means for the purpose of workers and employers is that there are suggested recommended actions for persons, for example, who are over the age of 60 and who are in frequent or prolonged or intimate interaction with persons in their workplace. We suggest remote working, and if remote working is not possible, we suggest masking, shielding, and where necessary, as has already happened, the perspex guards that can protect persons from interacting with persons. Similarly, persons who are currently smokers or persons whose body mass index is over 40, that may include me, and have occasional interaction with persons, then we equally suggest remote working or where necessary shielding between the mask and, if it's absolutely intimate, the face visors in addition to the mask. And where the persons have no risk factors and have infrequent or intermittent or distant interaction, we consider then looking at the work environment to see how it can be enhanced. For the most part, we are aware that the COVID monitoring unit has worked with almost every sector in this country to put protocols in place, and for the most part, the protocols have been followed. In addition to that document to which I just referred, which was previously available to persons, we have, and in addition to my entreaty to persons over 70 to remain at home, we have taken decisions firmly within the public sector. I've spoken to the head of the private sector on Saturday afternoon, and also advised that where in the private sector persons can do remote working, they should do that as the first option. In addition to that, we have heard the entreaties from the churches. This weekend, obviously, we took very, very stringent precautions because we were still very much in the beginnings of contact tracing. We are satisfied, after consultation with the Ministry of Health officials, that we can increase the number of persons who are officiating in churches from 3 to 10, and that we can increase the number of persons going to funerals from 10 to 20. But at the same time, anybody wanting beyond that, because there are large families in the country, and in many instances, even at 10 or 20, you are not capturing direct relatives, sons, daughters, parents, aunts, brothers, sisters of persons involved. There must be specific permission for more than 20 persons at any funeral, and the COVID monitoring unit will also ensure that somebody is there to monitor the protocols at these respective funerals that ask for additional persons, should they be approved in that request. In addition, we have been looking at the issue of our density generally, and how do you reduce density. May I say that I hope that during the course of these interactions, the medical personnel are here, and I want them to remind Barbadians as to what it is that really constitutes the gravest risk. And that is why we keep saying, wear your mask, sanitize, and also keep your physical distance. Because when you actually work out where the risk is, when I ask Dr. Phillips or Dr. George to speak to you, you will begin to see that just simply being in the same room as a COVID person who has been positive does not carry you to elevated risk. I also want to say that we are very clear on those persons who are visiting us, and to the extent that anyone is breaching our protocols, the government of Barbados, through the COVID monitoring unit, will take the necessary action for any visitors. We believe that by far the majority of them are compliant, but the handful who have chosen literally to ignore our mores, ignore our customs, ignore our laws and guidelines, then you must equally be held accountable with respect to what you have to face coming out of this country. With respect to the last point, we want to remind you that come January 14th, we will take a reset again. We are conscious, and let me say we do have, for example, 2,900 British persons on the ground alone. Those persons, for the most part, are going back out. Most of the flights that are coming in with less than 10% load. But the reason why we still have them coming is largely as a result of persons going back out and being able to join their families at the appropriate time. We do expect, however, that there may be some consolidation of flights given the low load count, load factor, but the Ministry of Tourism will be working on that. And one of the areas which I've asked the Ministry of Tourism to work on, which they're not yet completed for this evening's address, is the notion that we want to be able to designate hotels for specific purposes. So if a hotel is taking regular visitors who have already come through quarantine, that is what you are doing. Another one can have focus on dedicated quarantine measures. Another one will have focus on dedicated isolation measures in the event of persons being asymptomatic. In other words, without symptoms and not feeling poorly. And those are available to all persons and not just guests, should the need arise. As you heard from Minister Walcott, we do have space at Harrison's Point, but this is not a government that waits until things run out in order for us to execute our plan. And to that extent, efforts have already been made to stand up Blackman and Gollop in the event that it is needed for tertiary persons, in other words, persons without symptoms, but who are feeling well, but who nevertheless need to be isolated. And similarly, should we need, we also believe that persons who want to be able to stay in isolated facilities and who are prepared to pay on their own should be able to do so without us affecting them. And that is available to either Bajans or visitors should the need arise. But those designated facilities have to be settled tomorrow with respect. This is out of act of precaution because we need to make sure that in the event that we have the need, we can accommodate all persons. I'm satisfied that the Ministry of Health officials have been working beyond the call of duty. The thousands of tests that were done this weekend is indicative of it. Some people are already asking, why are we only giving figures down to Saturday, January 2nd? Can I remind you that normally and typically we would be given figures always that are 24 hours dated. So this evening we would normally have had the January 3rd figures. Those are being compiled as we speak. And of course, the January 4th tests are not yet finished because people are still testing, and those going to the lab to be processed from overnight into tomorrow. So believe you me, as soon as we get the information, we share it with you. That's what happened on the first occasion that we spoke to you last week. We were not prepared to wait for further investigation in order to be able to share the facts with the people of Barbados. What matters to us is that we are in this together, and we are in this together recognizing that the future of each and every Barbadian is at risk. And to that extent, if we each do what we are supposed to do, then we can get through it. I keep telling persons who we meet, who we mix with, what we do, we have control over all of those things. I speak to you tonight, there's nobody immediately around me. And that is why I'm in a position to take off my mask and speak to you. If somebody was on the other side of this table, I would have to immediately do this. But believe you me, once we follow the protocols and once we follow the reminders on the science, we can get through this. I'd like to ask Minister Walcott if we can move to the next stage of this session. A lot more information we expect will come out in the interactive sessions. I'd like to thank Mr. David Ellis, I believe, who has agreed also to help anchor this session and to allow us to be able to meet the needs and concerns and queries of Barbadians and visitors alike who are listening to us and participating in this. Thank you very much.
Thank you, Prime Minister. And ladies and gentlemen, you've heard the Prime Minister, you've heard the Minister of Health and Wellness, you've heard the CMO, you've heard the Minister of Home Affairs. I'm now going to hand over to Mr. David Ellis, the CEO of Starcom, who will moderate this session when you have an opportunity to ask any questions related to COVID, which you might have to the Prime Minister or any of the relevant or appropriate ministers. Over to you, David.
Good evening, Prime Minister, and also the other members of the Cabinet, and to Dr. George. Let members of the public know the numbers that you can call to speak directly to the Prime Minister and any of the officials here. You can call to reach the CBC number. It is 228-5562. That's 228-5562 or 5563. And as usual, where Voice of Barbados is concerned, the number is 4341-790. While you get ready to make your calls and put your questions to the Prime Minister, perhaps I should start by saying that it comes across as though when you compare where you were over the weekend with where we are now, you believe that there is some positive movement, but in the eyes of many people in this country, a movement of an increase of 211 new positive cases between Friday and Saturday is really alarming to many. And in all of this, the discussion which some people have been having is about your protocols. One concern which has been raised is that I've heard members of BAM make the argument that they believe that rather than starting the 5-day count at that point where people have tested prior to coming to Barbados, that ideally they felt that the 5-day count really should have started from the point at which people arrive in this country. They suggest to me that they've been telling government this for quite some time, but the government has rejected it. Their argument is that if a person tests 3 days prior to coming to Barbados, they can do all sorts of things in the intervening period that can leave them vulnerable. And therefore, when you test them at the point where they arrive here 2 days later or so, they are inclined to be in a position to give you false negatives. This has, to some extent, been supported by one of the people who called today's edition of Down to Brass Tacks, a virologist who has been a long-term visitor to Barbados. I'd like you to explain to the public why you have rejected BAMP's suggestion apparently outright, and what is the science that you are following in this regard, because you constantly tell Barbadians that you are following the science.
And let me say, even before I start, Wilfred Abrams has just indicated that there is in fact one female who was positive as opposed to 0. As it relates to your direct question, I'm not a scientist and I'm not a doctor. And the one thing that I insisted was that we follow the science. When BAMP raised this issue, and may I say that BAMP, the Barbados Association of Medical Practitioners, does in fact sit on the EOC, I am informed by the Minister of Health, and he and the CMO can continue to speak after my initial comments. But when I was informed of the difference of opinion, I picked up the phone and I called the Director General of the World Health Organization, Dr. Tedros, and Dr. Etienne, the Director General of the Pan American Health Organization. We agreed that a session would be convened to facilitate a conversation between the Barbados public health officials and the Barbados Association of Medical Practitioners with respect to what, in fact, is the appropriate timeline for persons to be tested after the first tests, given the concerns that persons had. As a result of that consultation, it was made clear that 4 to 5 days was sufficient after the first tests. When you really look at the facts that confront us, thousands of persons have received second tests in this country since June, within the 5th day as is presently constructed. The difficulty does not seem to have come from that. And the fact is, the WHO confirmed in that call 4 to 5 days. Out of an abundance of caution, I said to the Ministry of Health officials, as we went into the winter season, shift that to 5 days flat. We have nothing to lose, and that is exactly what we have done. And for the most part, we believe it has worked and continue to work. But I'd like to invite Minister Bostic and thereafter Dr. George to be able to add, because I was not in the call myself with the WHO, they were, but in these matters we have remained exceedingly close. Up to this weekend, I spoke to Dr. Tedros yesterday on our current situation, and Dr. Etienne, I've spoken to her day before, as well as through email contact again yesterday, so that we get the best of public health information, because we are conscious that all doctors are not necessarily public health specialists, just like all lawyers are not tax specialists or criminal specialists.
Thank you, Prime Minister. I want to go back to the beginning of the pandemic. When we first started on this journey, we were using 14 days quarantine for persons coming from high-risk countries. And back then, we were dealing really with Wuhan and China initially, and then we went on to the others. That was done at the time because it was felt that 14 days quarantine, and this is without testing, by the way, because especially in those days, we did not have a lot of tests, and the 14-day quarantine period was being used by most countries because that was the advice that was given by the World Health Organization. As things develop, as we learn more about the virus, and then based on our own experience here in Barbados, we made certain determinations. And those determinations were guided also by the World Health Organization. I do not want for Barbadians to think for one moment that there was a link between what we are facing now and the protocols that we have for persons to enter into this country. The results are there. The proof is there. Prior to these last few days, most of the cases, the positive cases that we've had in Barbados, we were able to capture using the method of the second test and the days that we have had allocated for that test. And we're testing 5 days after the first test was received. The 14-day thing is not utilized in all countries, and countries are doing various things based on their experience as well. I can tell you that there are countries that still use the 14 days because there's no entry requirement. In New York, for example, within the last few months, they started to allow people to enter with a 72-hour test, the same thing that we're doing here, and 14 days quarantine. However, at the end of the 4th day in quarantine, there's a second test, and if you opt to take that test and the test is negative, then you are allowed to go. There are some countries that use a 7-day period for a test coming into the country, and then you go into quarantine. So there are several things at play here. But I am saying that in our case, what we are doing, we have seen from the results that it has worked. We've been doing it now for a few months. We've had no issues, and I would not wish for persons to associate the current state of play with that particular protocol. And that is what I would like to say in relation to that. We respect the views of BAMP, their stakeholder partners. We listen to everyone. But as Minister of Health and Wellness, I have to take my guidance from the technical team, the public health officers, the chief medical officer who work in the ministry, and we also get guidance from World Health Organization as well as PAHO. And I stand by that the protocol that we have in place has worked for us, it continues to work, and that is where we are with that one.
Well, this is a forum largely for the callers. So let me go to Ricardo from St. Michael. Good evening, Ricardo. Can you hear us? Some difficulty in hearing that first caller. But if I could use this opportunity then to just quickly follow up on that particular point, because you say to us it has worked. We say to you, Minister Bostic, yes, it worked for a period, but once the numbers increased, it would have put you under greater pressure.
Hello.
And to that extent, the numbers that we have today may defy your argument that it is working now. How do you respond to that?
Hello?
Are you there, Ricardo?
Yes, I'm here. Can you hear me now?
Yes, I can hear you now. Okay, let's take your call, and then if necessary, I can come back to Minister Bostic on this. What's your call? What's your question?
Yes, yes. Hi, good evening to the PM. And just let me say, first of all, I want to congratulate the hardworking team at the laboratory of the Best of Santos laboratory. I know they're working hard, and my hat goes off to you for really dealing with this terrible situation that we have before us in this island. My question goes to both Minister Bostic and the PM. Do you think that it would not be a good idea for at least say 2 or 3 weeks to stop the planes from coming here? That is my question. First question. Second question, I will go off the line to hear the response. My second question would be also that a majority of these clusters, as they say, they're still investigating clusters, mainly coming down from the West Coast, because there's evidence that a lot of the tourists that have come here, okay, they are really not adhering to the protocol. There are ways to take off those bans, which you say by Wednesday they will be putting on, dealing with a different band. Okay, so is it not possible when you see this and the hotels that are involved in it, will there be any thing doing to them as far as the law is concerned? That's both my questions.
Ricardo, for your questions, and I hope you're hearing me, because I know we had a little difficulty hearing you at first. Your first question is about the planes. In reality, the majority of planes that, as I said earlier, are coming to Barbados with low load factors. So let's take it. Today, British Airways landed one plane with 30 persons, another one with 24 persons. But in every instance, they're going back out with far more than what they've come in with. And there are people who would have come here pre-holidays and during the holidays who expect to go back out. May I remind us that we never really closed down at all during the year. But what happened is that the loads completely dropped off because of a disinclination for travel, both on the part of our own people as well as persons from the source markets coming here. I think we are all aware that the numbers from the United Kingdom have dropped significantly and continue to do so because of their own difficulties there. I gave you British Airways. Virgin, for example, would have brought in today 63 persons, but they're going out with far more. And if you look at all of the airlines, as I was looking at the numbers provided to me by the Minister of Tourism, in every instance, load factors are much less coming in the next 10 to 12 days as opposed to going back out. So we have to be able to allow persons to get back home who have come here as short-term visitors. And it's against that background we had an extensive session with the Ministry of Health to ensure that the numbers which are coming in will not put undue strain on our healthcare system. I've said, however, in the past that I know how to press brakes and I know how to press the accelerator. And if we need to press further brakes on this matter, believe you me, we should and will. But what we are very clear on is that a national shutdown of our borders or a national lockdown of the country will carry with it significant pressures to other types of persons and to all kinds of issues. Let me give you an example. In the last week, nobody died from COVID, but in the last week, somebody died from dengue. If we were to shut down the country, as some are asking for, then we run the risk of persons not being able to carry out the duties to do the debushing and to get rid of the water that's settling, and equally, other facilities and services that people need, whether it is for medical support for persons who have heart condition or diabetes, etc., they will not be able to get the normal treatment or access to the goods and services. Then there's the bald reality that there are a lot of people in this country who regrettably are still living day to day or week to week, and for whom work is absolutely essential in order to maintain themselves and their families. So look, we have had to manage risk throughout this, and this is the difficult part of this whole pandemic. But as human beings, from the very beginning of our conversations in this room, I reminded us of how we manage risk when we light a fire to light a stove, how we manage risk when we go to cross the road, how we manage risk on a whole host of things. I do accept that we need to remind persons of what the real risk is, and at some point I'm going to ask Dr. Phillips or Dr. George to be able to remind Barbadians what that is today and where the risk comes. With respect to the bracelets and the monitoring, I have to confess to you that I really would have wanted to see the electronic bracelets before. I believe that there was a story that went out on CBC that showed that regrettably, because of the dedicated testing and interface between Google and Apple, it took far longer for us to deploy the electronic bracelets that we have in hand than we would have liked. When you see the bracelet, you see that inside them there are some wires, and therefore, unlike the cloth ones that people have been using thus far, if you cut that electronic bracelet, an alarm will immediately go off that will allow persons to be able to find you. We were fortunate with the vigilance of staff in hotels to be able to catch those persons who tried to leave the hotel to go to the airport once they received notice that one of them was positive. With the electronic bracelet, from the time they seek to tamper with it, then that alarm would immediately go off with the GPS tracker that will immediately send a rapid unit to be able to find them. And I hope that literally, in fact, Minister Bostic can tell us whether, I believe from as early as tomorrow, those electronic bracelets will be deployed in order to be able to help monitor the movement of persons. That will be a significant improvement in our capacity to ensure that people don't play the fool with respect to following the protocols. The second major difference is what Dr. George would have announced. Prior to this, you would have had some level of restricted movement on property. We are believing, and we've said that for the first 48 hours, persons must remain in their room, particularly during this heightened period, and especially with the absence of high levels of vaccination. And therefore, in that respect, we expect that those persons who come in for quarantine will spend the first 2 days in their room before then being able to go out and mix, subject, of course, to them having a negative test result. I think those were the two aspects of the questions that you asked, Ricardo.
Okay.
Um,
Thank you, Ricardo. So is
David,
there other people
yeah.
coming in? There's George from New York.
David, I'm not sure
Yes,
if Minister Bostic, please, would just like to add anything to the electronic bracelet part, because he's more au fait with it than I am.
Yes, because there's also a question here for him too.
Yeah. And then I think you had a question for him as well.
Yes, which is related.
Yes, please.
Yes, Minister Boston.
The question that you had asked first, it is true that we had a larger number of persons arriving into the country, but those numbers did not cause a breach in the entry protocol. Yes, we had an issue the week leading up to Christmas. We had a backlog, but the backlog was dealt with because we recognized where we had issues and we took steps to correct those issues, including deploying more personnel. And ever since those days, the lab has been doing over 1,000, reaching about 1,500 samples in a day, which is a significant achievement. So we've been able to do what we have to do in order to make sure that that protocol was in order. So
Minister Bostic, if the protocols are not to be blamed, then the logical question is, what are you placing the blame on? How did we get to this position? That's basically the question that someone is asking to me as well.
Yeah, and my answer was in relation to the entry protocol. You would recall that we did say that there were breaches to the quarantine protocols. We have been fighting that is known. We had that, that is not a secret. That is something that we've been working on. I can tell you that I can think of at least 10 breaches. Some persons have been brought before the law courts and prosecuted, and there are others where the process is ongoing. But I do not think that one can say that it had to do with the entry protocol, and that is the one that I'm speaking about at this point in time. There are several protocols that are guiding us through this process, but I am saying that I am confident that the entry protocol is holding its own.
If I may add to that too, David.
Let's get George from New York and let's see where we go.
If I may just add to that, is that clearly we have to strengthen the enforcement. And that's why the electronic monitoring bracelets are there. And that's why we intend also, and have been having, in fairness to the Ministry of Health, meetings with hotels where we felt that there were breaches that were reported to us either through workers or the COVID monitoring unit people on visits to the hotels.
George from New York, good evening. If not George, then we go to Abdullah in St. Michael.
Hi.
Is this George?
My question is about vaccine. Basically, I understand that there's a shipment supposedly to reach Barbados pretty soon. And my concern is, I want to know whether or not these will be made mandatory. If persons decide that they don't want to take the vaccine, is the government going to step in and say, you have to? That's really my question.
Okay, thank you, George.
Vaccines is one that we are aggressively undertaking. Under the COVAX facility, each country is expected to receive 20%, and Minister Bostic can speak to that in detail. Beyond that, though, the Cabinet of Barbados took a decision that we would want to be able to ensure that 60 to 70% of our population is vaccinated. because that is the level that the public health officials have advised us would allow us to trigger herd immunity within the context of the country. The issue globally is one of access. The issue globally is also one of approval. And to that extent, you should know that at this point in time, as we speak today, Monday the 4th of January, the only vaccine that the World Health Organization has approved is the Pfizer one, but they expect to be able to have other vaccines approved, over the course of the next few weeks and early in the few months. Countries like the United Kingdom have used their own national regulatory systems to allow them to approve the ones that they have already started rolling out over the last 3 weeks. In the United States of America, they use their own regulatory system as well to be able to approve Moderna and Pfizer, as you are currently aware. We in the Caribbean do not have an appropriate entity, and therefore we rely on either the international entities like WHO or PAHO, or we would have to assume and adopt the benefits of the advice coming from national regulatory entities in the European or North Atlantic or China or Cuba, because for that part, Cuba, for example, has done excellent work in vaccines over the years. China is on the verge of approval of 2 of them. So we expect that there will be options. We hope that we can have access to them, but part of the difficulty is that the larger countries of the world have in fact pre-ordered numbers way in excess of what they need. So for example, some countries have ordered 4 or 5 times what their needs are. It is through this very difficult situation that we are individually and collectively within CARICOM trying to see how fast we can access at an earlier stage the vaccines. We are confident that we will get them by the first quarter of this year, but by the same token, we are hopeful that we can see how we can even try to enhance that arrival time. I can't promise, but far from that, we are working assiduously because we recognize that most Barbadians will accept, and it is not going to be mandatory, but most Barbadians will accept some form of vaccination. The issue of effectiveness is not vaccines, but in fact vaccinations and rolling out. And why? Almost all of us have a little thing on the side of our arm that we got as little children when we went for vaccinations. And we continue to offer vaccinations to most of our children. In fact, I think the levels are 80 to 85% effectiveness based on what level of what vaccination it is. So I'm hopeful that this will allow us to be able to see the way through 2021, in addition to all of what we've done in 2020 and we're doing now, but to have the additional benefit of vaccinations to make persons, to protect persons from being able to catch this virus.
Let's see if we can get another call here from Abdullah and St. Michael.
Hello, good
Good
evening.
evening. Yes, welcome.
Yes, that's the final question. Good evening, Prime Minister. Can I go to church and
Can anyone go to the church or mosque
worship?
And worship individually? That's your question.
No, at this stage until the 14th of January, we're holding off on that, largely because it's indoors and largely because of the risk associated generally with singing, etc. We met with the Barbados Christian Council, the Barbados Evangelical Council, and the Muslim Association of Barbados, and we agreed to a framework. As a result of entreaties from other church members, we are agreeing that we can expand the number of persons presiding over the services from 3 to 10, and similarly I would have announced what we would allow with respect to funerals, which as we know is a very difficult time for persons, and therefore we're conscious of it and conscious that the majority of them will in fact adhere to the protocols, but we're not taking any chances. We are going to deploy persons who ask for any and receive approval for any numbers over 20 at their funeral.
All right, thank you very much, Abdullah. This question of a few clusters being investigated, this is what we were told earlier by Dr. George. When you say a few clusters, we assume that's 2. How big are these clusters? And people are a little confused about the language that you all have been using. Local spread, not community spread. To some people, it sounds as though you all are involved in semantics. What's the difference? I heard a lot of people laugh at that. Are you really saying here?
Or Dr. Phillips, either of the two to answer. Thank you.
So thank you so much. In Barbados, there is local transmission. Yes, we use the word clusters because clusters are small groups which we, based on contact tracing, have said they are connected. We, at this point in time, do not have information to suggest that there is community spread. What community spread indicates is that the contact tracing no longer is able to contain and identify contacts. We have not reached there yet. So we have local spread, that is correct, and we have clusters. I indicated that there are 3 clusters being currently investigated. As many of you know, some of the clusters came out of the bus crawl. Some of the clusters came out of a group in the West Coast. And these clusters require the contact tracing team to fan out and to make sure that it works on leads. And once we have those leads, we go out and test those individuals. And this is what contact tracing is about. We update the issues surrounding clusters on a daily basis, and those are shared with the public health team. And so far, many of the clusters, the information that we have been completed. Out of those clusters, there have been a few cases. So in one cluster, there were 7 cases that were positive, and those 7 persons were identified. They will be tested again, and their immediate contacts be tested. And that is how it works. So that is a process that will continue until we are able to identify most of the cases, the index cases, or the cases associated with the start of each cluster. Thank you so much.
How much of that do you have to do? In these 3 clusters, are you still in that position where you have to identify the index cases of all?
Yeah.
If I may, Minister Walcott received the briefing from the senior medical officer on this before coming. Dr. Karen Broom, who is currently seconded to the Pan American Health Organization, but who has kindly on vacation come back in to help the Ministry of Health over the course of the last week. So I'd like to invite him to address in explicit detail, because while I accept that Dr. George has given you general, I think the public of Barbados wants specifics on this matter. And then thereafter, I'd like to invite Dr. Phillips or Dr. George to explain properly what the definition of community transmission is. Although I must confess, like you and most Bajans, as far as I'm concerned, once people are catching it locally, local transmission and community transmission is just semantics to me. But as I keep saying, I'm not a scientist, so I have to respect those who are. Minister Walcott, please.
Thank you, Prime Minister. And if I may, as Dr. George said, there are a number of clusters, and I believe I spoke about it when I last addressed you 2 days ago. Of course, most Barbadians are familiar with the cluster associated with the bus crawl, primarily affecting the Dodds prison, but also there are other cases associated with that bus crawl. And thus far, I've been told they've been doing the contact tracing, and so far there seems to be 13 additional cases, separate and apart, 13, separate and apart from the 173 cases, I believe, associated with the prison. There seems to be an additional 13 cases in that cluster related to that bus crawl, and this is going on. I get the impression that in terms of the number of contacts being traced, they've been doing quite well, and we know that a number of persons who were not necessarily close contacts or indeed part of or high risk in relation to contacts, those have also been tested. Dr. George spoke about clusters, and I'd have before, about clusters on the West Coast. There's one particular cluster seemingly asserted where we have identified the initial person, but so far there are 19 additional cases associated with that cluster. I am pleased to say that it seems in terms of the, in relation to the number of contacts traced to be tested, I see here that there are not many outstanding in terms of contracts to be tested, and certainly in terms of lab results outstanding. There's another cluster on the West Coast, in which there are 4 persons in that cluster. There are some other possible clusters which are being investigated. And I said possible clusters where you have perhaps there's one person here who came from St. Vincent, and he turned out to be positive. He came with negative tests, and after a few days, and when he was repeat tested, he was positive. He had come from a very low risk country at the time, that was St. Vincent and the Grenadines. He's a South African originally, apparently, who had been in St. Vincent for some time and came over to Barbados. He's been, in terms of the, as it relates in terms of the places where he went to, a number of places in Barbados, and a number of contacts were identified. Some of them were tested and placed in quarantine, and thus far I am happy to report that there are there are only 11 results outstanding in terms of, as it relates to that particular investigation, and there's only he remains the only person positive. There is a similar one, a possible cluster which is also being investigated on the West Coast. Again, a number of persons have been tested after contact tracing, and there remains only 1 positive, and I see here 3 outstanding test results. So those are the clusters in effect. There are 3 active clusters, and we're also looking at 2 possible clusters. But as I said, contact tracing going on, but we have not yet identified any additional cases. Thank you.
Could we get Dr. Phillips or Dr. George address the definition of community spread, please?
So community spread is where your contact tracing, your efforts to contact trace are outstripped, and you don't have control over your spread in your population, and therefore you have community spread. You've lost the capacity to trace. We have indicated to you that we have almost 100 tracers working with us. The University of the West Indies has recommended 100 and up to 150 tracers, which we are going to try to bridge that gap to make sure that we don't get to the level so much as to suggest community spread. That is defined by the World Health Organization.
Thank you very much,
Okay.
sir.
Let's move on to another caller, if we can. And we have here Mr. Straker's tenantry. You are on the air, Mr. Straker's tenantry, if that's the name you prefer to go by.
Yeah, good night, Mr. Ellis.
Yes, good night, sir.
Good night, Mr. Ellis.
Yes, good night. Go ahead. You're on the air. Unless you're having a difficulty hearing me. While we sort you out at that end, let's go across to Barry Allen from the Nation News. Are you there, Mr. Allen?
Yeah, good night. Good night, Mr.
Yes, I
Ellis.
am, David. Thank you. But I think Mr. Straker's tenantry is coming through as we speak. You want to go to him?
All right, let's go to him and hear what he says first.
Yeah, good night, Mr. Ellis.
Yes, sir.
And good night to everyone. Now, Mr. Ellis, I've got 2 concerns here. Now, the Minister of Home Affairs has said that the prison, there's no one out, no one in. But he said that they can accommodate 100 staff and they're rotating them as best as they can. But yet still, he said that the defense force and the police will be coming in to complement that. Now, that's a contradiction. You still there, Mr. Ellis?
Yes, we are listening to you.
So I can address that
Expand
situation.
on why you consider it a contradiction.
Right.
You're a little faulty. Yes, sir. You want to
R-
respond, Minister?
Yes, I do. It's not a contradiction. We initially had the police and the defense force going in to supplement the shifts when the first batch of officers were sent to quarantine. So a number of those are already in place. The BDF and the police are not actually going into the prison population. They're doing mainly perimeter patrol, things that do not put them in contact with the prisoners. So where officers will normally be doing that work, that is now being done by the BDF or the police. And they also have a rapid response force on standby in case of anything. So they're not coming into contact with the prisoners. They're handling their business from outside and leaving the prison officers and their normal shifts to do the work directly interacting with the prisoners. So it's not actually a contradiction.
Before you go, tell us what was the process for testing within prison all this time, especially since March of last year, March, April of last year.
What was the testing within the prison? Persons would, like anything else, persons would have been tested who displayed symptoms or who were indicated for a test. So just like anybody else, there was not random testing in the prison. There was no random testing protocol, or it wasn't that we were testing everybody every week or every month if somebody indicated that they weren't feeling well. In the same way that if you went to the polyclinic and you had sniffles or something, they may recommend you for a test. That exact same methodology was applied within the prison. We went to the full-scale testing.
Positive tests in the prison.
Our first positive test for one of the prison officers was coming out of this bus crawl. That was the first indication.
For the prison officers.
Initial prison officer, yes.
You've locked it down to the prison officers as it relates to the inmates.
No.
When was the first test? After the prison officer tested positive or before?
No, after the prison officer tested positive. So following the test, the positives from the prison officers, we then started to do the testing within the prison itself. And that is when the results came out for the prisoners. So prior to that, we had no positive test for a prisoner.
How many more prisoners prisoners need to be tested now?
All of the prisoners have had their samples collected. We are still awaiting the results of the testing from some of them, but everybody has been tested, and we are now about to roll in to the second test after the 5-day passage.
I wanted to add that if I go before we go to Barry, the fact that the prison officer who presented with symptoms which triggered our interest, in fact there were 2 prison officers on the day, if I recall, a gentleman and a lady, and the fact that they triggered our interest does not mean that they were the first people to have COVID. It just simply means that they were the first ones to display symptoms that led to our testing, and as a result, it then led to a complete, comprehensive testing of prisoners, prison officers, and civilian staff at Dodds. So the public health people are still trying to determine where it may have started in the prison, but for sure it was there, and those persons, as Wilfred said, were related to wider activity, which led then to us asking the rest of the country to identify persons who might have been involved in some of those activities.
I thought he had said earlier, at the start of this process here, that some people had already been tested and were due their second tests after 5 days, and others were also to be tested. Can you clarify for me whether that is indeed what I heard?
No. Everybody has been tested. Some are pending getting the results back. But let's use the superintendent as an example. The superintendent was in the first batch of people. He's in quarantine. He's due to have his second test in a day or so, right? And other people in that situation.
Okay, thank you. Barry from the
Hi,
Nation.
good afternoon. Hi, good evening. This is Barry Allen from the Nation. I have one question for the Minister of Home Affairs, Mr. Abrams, and one question for the Chief Medical Officer. Mr. Abrams, have early investigations indicated if there would have or could have been a breach of the prison's internal protocols that would have led to over 100 inmates in the space of a week being infected with COVID-19?
Barry, quite frankly, we're not actually there yet, right? Our first priority now is to stabilize what is happening in the prison and to ensure everybody gets tested and people get the care that is warranted. After that, we will do full investigations into what happened, how the spread got to the point where it got to. But being quite frank with you, that has not been our priority right now. It is challenging trying to manage that situation. A prison is a bubbling pot, effectively. We're trying to keep that lid on. We're trying to keep everybody calm. We're trying to provide the best care that we can for the persons who are within our care and custody and our control. And we're also trying to motivate the prison officers who are there and who are having a difficult time, such that we even had psychological counseling for some prisoners, some prison officers, because of the uncertainty of the situation. So trying to point a finger and figure out exactly where it happened, that will come after. Right now, our first priority is to get through this and make sure everybody gets tested, gets categorized, and gets the treatment that they are entitled to, so that we can get past the situation and bring it entirely under control.
And my follow-up question to you, Fred, regarding that is the Ministry of Home Affairs satisfied that the nexus of this prison cluster is, and in fact, the so-called super spreader, the bus crawl?
I actually didn't catch your question. You were dropping a note.
Right. Is the ministry satisfied that the super spreader bus crawl is the nexus of the actual cluster that is now obtained at Her Majesty's Prison at Dodge?
Barry, quite frankly, that's not a question for me as the Minister of Home Affairs. That is something that would be investigated and dealt with through contact tracing and through the Ministry of Health. As I said, I am not even trying to figure out exactly where it came from at this point in time. I'm trying to figure out who has it so we can treat with them, deal with them properly, and get past this. So maybe somebody else can answer that, but I can't shed any light on that for you.
Anybody else shed light on it though, Barry? Because if you
I
don't
think it
know
is
how
fair-
it got here,
Yeah, I
then
think it is fair
there's a
to say.
potential for other problems.
I think it is fair to say that Dr. Brooms indicated to us in our confidential briefings this afternoon that they are in the process of plotting the information. They have not yet finished the plotting, but that they're satisfied that there's information that would link one or two people at the prison to the West Coast in terms of moonlighting, in terms of how they may have been linked to the cluster on the West Coast. But until such time as Dr. Brooms is in a position to finish that plotting along with the other medical health personnel, anything at this stage would be speculative.
Thank you.
Who can answer a question about the Queen Elizabeth Hospital? Because it wasn't so long ago that the government was putting a lot of emphasis on trying to protect the QEH from COVID. Can anybody confirm or deny that medical staff at the Queen Elizabeth Hospital have actually been tested for COVID? And if so, why?
Yeah, if I may, David, we have received, just as we did with persons from A1 supermarket, Emerald City supermarket, just as we did with a person who was, for example, a mechanic elsewhere. There were one or two persons whose sister or otherwise were involved, and there is a report that has literally just come in from the CEO of the Queen Elizabeth Hospital with respect to some of those things. I'm going to ask Minister Walcott, because I'm talking to you, if he can go to the last page of that report and begin to examine, because in some instances, and this is the point I was making earlier, where persons have the appropriate PPE, they were deemed not to be at risk. But in some instances, I believe that the testing and tracing is going on. Minister Walcott?
Yeah, with that, it literally just
just came in a half hour ago while we were doing this.
So he will have to get a chance to look at that before he can come back to
While
us. And I
he does
suppose
that,
we
David,
will
while
look
he
to see
does
if there's
that,
anyone
no,
on the line. There's a Mr. Walker from St. John.
no, but
He perhaps can.
while
Yes,
he
yes,
does
Minister,
that,
yes, Prime Minister.
while he does that, I need to explain the rationale. Barbados has a lone, comprehensive, fully outfitted hospital. The government took a decision that we wanted as far as possible to keep COVID out of it. I think all of us watch the news. We are not God, so we can't guarantee that it will never get there. But thus far, it has not gotten there through any patients going in. And that is why efforts were made also to do a triage at A&E in order to minimize the opportunities. We've spent significant sums of money to be able to raise Harrison's Point to the level to where it was. We did a dry run at Blackman Gollop earlier in the year, as you know, while we were doing Harrison's Point, and we were satisfied that that equally could be a second facility. We also brought in 100 nurses from Cuba and I think 1 doctor, and I believe that we are trying to make additional efforts to even further amplify what medical personnel we have. As it relates to the exposure, any exposure of nurses, as I understand it, would be as a result of family exposure and outside of the QEH exposure. But Minister Walker can correct me if I'm wrong. Thank you.
Verify whether that is indeed so.
We can only go on the evidence brought to us, David. I think you know that better than most.
Well, there's evidence that is brought to you, and then there's evidence that's brought to the media too. So the point is, I want to hear what
In
is
those
being said
instances,
in
I
that
would be
regard,
happy for you
because
to
we
share
go
it
back
with
to the
us.
fact that this is an area that you sought to protect as much as possible. And from what I gather, there's some measure of nervousness among some of the people working in the institution right now.
Mm-hmm.
I think we still have to hear
Okay,
from Minister Walker. Yes, yes,
I'm
Minister.
just trying to go through the report now. As it, this, in terms of the medical intensive care unit, I believe there were 2 persons there related, 2 nurses who attended the bus crawl, and I believe that they have been tested. In addition, 36 other persons, doctors and nurses who are associated with that unit, have all been tested. So from what I'm seeing, I'm not seeing any positive cases from that sample. In terms of before, again, 14 doctors and nurses were tested there. I'm trying to go through this thing as I go through it. Apparently, one of them attended a bus crawl. So this is again a situation where you're being precautionary in a health institution. I see no positives there yet. In the respiratory unit, 2 nurses were swabbed. This is awaiting results. A patient of a sister who tested positive. This had nothing to do with the bus crawl. And this unit, which has been closed, the respiratory unit, because the 2 nurses staff it and they have been swabbed and they are awaiting the test results. In the case of the surgical intensive care unit, one patient has been swabbed. I believe is linked to the mother of a patient of a prison officer. So the patient has been screened off. Patient care has continued with all the necessary contingency plans and awaiting the report. And then in the matter of engineering, there's 1 person in the engineering department where apparently his girlfriend attended, brought the bus crawl, and he, not certain if I don't think the girlfriend is positive, but he was tested and other staff members were tested. There is a doctor who normally assigned to the accident and emergency department, and she has been contacted as a possible secondary contact to 2 positive cases. Her first test is negative, and she is still waiting in terms of having a second test done. I believe there is a prison doctor who serves a doctor consultant who serves also as a prison doctor, is on home quarantine pending a second test, so he would have been tested as part of the persons at the prison. And I believe there was one patient in the artificial kidney unit who's a contact of a positive case in the community. Patient has been tested and they are being investigated. We're waiting results and still being investigated. That is, as I see here, in terms of the report. So I know that there's something read out in the news media about nurses and A&E and all sorts of things, but the report does not bear this out. Okay? Thank you.
Given the position that has been taken on trying to protect the QEH, what do you see as the implications of all of this that you have just revealed? While it is true that nothing positive has come to light yet, you know, in these circumstances, there is no movement towards a test generally unless you have some reason for concern. So how do you see the authorities trying to deal with this type of challenge with all these people who've been to the bus crawl and that sort of thing? This bus crawl was so successful, Minister. Do you know, member of the cabinet went?
I wanted to know if you were on it. I thought you shut down VOB.
So as I said, David, we have certainly done very well over the course of the year in keeping, and I think you remember when we started in March, we made it a point that we were going to go all out, and hence the investment in Harrison's and all of that, to keep COVID out of the QEH. And in this case, unfortunately, as you can see, one or two persons went on this bus crawl. Persons are still entitled to go where they want to go in Barbados. And as I said earlier, there was one case in obstetrics and gynae, and she was a patient who'd gone to the bus crawl. I should mention that this lady has done well and has been, in terms of from before, and she was dealt with at the Enmore Center. You remember that we'd also set up a unit at the Enmore Center initially. This is still available as it relates if you need to use it for persons who require surgery, or in this case, perhaps obstetric treatment. The QEH has set up a whole process as it relates to how persons who suspect and have issues can relate. And as we said earlier, has been said earlier by the CMO, as it relates to COVID, it is about risk assessment, risk management, and everyone will not have the same level of risk. It has to do with the exposure, the contact.
Since you had to use the unit out by Enmore's, perhaps you should tell us what additional work has been done to upgrade it after all the controversy that erupted last year about the extent to which some people felt that it was not up to standard. So what has been done to improve on it?
Mr. Ellis, I'm not certain, but there's some people that didn't think it was up to standard. I know that some work had been done there, and I'm certainly not the person to speak to as it relates to the specifics of any modifications or work that was done to that unit. I assume perhaps...
Let's go to Shamari, because we can come back to that another day. But Shamari in St. Michael has a question. Welcome.
Hello, good evening. Thank you very much for taking my call. Good evening, Prime Minister Miyamati. I have a quick and short question in regards to communication with the public. Is there a number for the government information services on WhatsApp that can communicate alerts and etc. Maybe through WhatsApp or Telegram, because that might be a little bit more effective against the spread of misinformation on those services.
David, I'm not sure if you heard the question and can repeat it for me, please.
Broke up quite a bit. Can you repeat the question, Shamari?
Yes, no problem. That's fine. Basically, I'm asking if there is a number on WhatsApp or Telegram for the government information services, so that they can put out announcements or information to combat the spread of misinformation on places like WhatsApp and etc.
He's asking for some kind of line to counteract what he sees as misinformation that is going online and perhaps otherwise, and that this number should be located in the Government Information Service Is there any such hotline?
Yeah, there is a hotline. We've had to expand the numbers significantly. I think Minister Bostic can more speak to that, or Dr. George, because I know that we had to try and get an automated system. We asked tourism to also share theirs with ours, because obviously once we started talking to the country in this terms late last week, there was an explosion of the persons calling the hotline. We have also recognized that we need to have better and more dedicated communication from the CMO's office, not necessarily from the CMO himself, because as you would appreciate, the CMO also is the one at law who has to do a number of things, not to mention the correspondence, not to mention the medical issues. So I think that we've agreed that the Ministry of Public Affairs is going to have to assign somebody in a dedicated fashion to the Ministry of Health to help answer a lot of these issues, especially at this heightened period of time as we go forward. Mr. Bostic, is there? You have to forgive me, members of the public, because of the physical distancing. We're looking around. We're not in eyesight of each other. Minister Walcott is in the same room as me, and the others are in a different room. So if you hear me sounding tentative as to who is at the podium, it is because I cannot see them. Thank you.
Thank you, Prime Minister. We recognize that we needed to do things a little differently in relation to how we relate and respond to the public, relate with and respond to the public. And so we have actually put together a particular team, a unit within the ministry to be able to do so. But the ministry on its own does not have all the resources, and so we welcome the support from the ministry with responsibility for broadcasting, because that will give us the strength to do what we have to do. The issue in relation to the hotline is one that we've been addressing from time to time. The problem is that we need to have an automated system that will allow us to be able to do a lot more, but regrettably, we are unable to get that system from any of the providers within the next 4 to 6 weeks. And so we are communicating with the Ministry of Tourism to be able to use the call center so that we would have an expanded service. And that is where we are. But I can say also that the technical persons, along with myself in the ministry, we've been getting a lot of emails, and a lot of persons have been contacting us. And if we are unable to respond to you, it's honestly because we are flat out. I mean literally flat out, and we have been flat out since the week leading up to Christmas, and that is why we ourselves are not able to respond to each and every one of you. But with the assistance of Minister Abrams and his people, we believe that we'll be able to correct this.
Person says, so why is the government passing this off as if BAMP endorsed the protocols? Or am I mishearing? They also say, why are the other clusters not being named, as was the bus crawl, so folks can come forward if they suspect that they were part of the cluster? Again, am I mishearing? This is what this person writes to say.
I don't think so. I think that Minister Walker just gave absolute details. I think on another occasion, there were persons, and there have been a number of people in the media, and I thank persons for taking the preemptive action in terms of shutting down a number of restaurants and bars that were involved in the contact tracing. So I think you would notice that on the bus crawl, we haven't named the owner of the bus. We haven't named the persons holding the bus crawl. Dale may have spoken to the name of the crawl, which is another matter for discussions on another day. But we've not spoken to any of those details. And I think we try not to breach the privacy of individuals who have been affected. Similarly, however, we've been very clear that those people on the West Coast, in terms of those entertainment establishments that the contact tracing came out, have themselves also to be responsible. This government is not going to favor anybody, and there's a lot of foolish talk out there about whether we are going to have 2 Barbaduses. Let me address it up front. If Mia Motley gets COVID tonight, test positive tonight, I have to go to Harrison's Point, and not tomorrow night. 2 o'clock in the morning or 3 o'clock in the morning or whatever time the Barbados Defense Force can come to me. Clearly, we've had to enhance the number of vehicles under the control of the Defense Force for carrying persons to Harrison's Point because of the increase in numbers. Clearly, the prisoners have remained within the prison. But let me also say that there are a number of people of all colors, black, white, and Indian, at Harrison's Point tonight as we speak, rich and poor. And perhaps now is as good a time for us to invite Dr. Corey Ford, who is our infection, and Barbados is blessed to have him as an infection specialist help us guide us through these last 10 months, because a lot of countries don't have an infection specialist in the region. And you've heard me say on previous occasions, the work between Dr. Ford as the clinical specialist and Dr. Sanji Beckles at the head of the lab has allowed us to be able to do some fine analysis to be able to determine where persons' viral loads come between 30 and 40. I learned a little bit that you then determine whether that person, through a second test, is actually going into the disease or if the person is coming out of the disease and being a shedder. But Dr. Ford is the best person to answer about some of these conditions too.
Dr. Ford? I think he's muted from what I'm seeing.
Good night.
Here.
Good night,
Good night.
Barbadians. Good night to all Barbadians.
Yes.
I welcome you in these trying times in country. And I would like, before I even start or go any further, David, I just want to give kudos to my team at Harrison's Point before I go any further. A group of people who have worked extremely hard and now are working even harder under very difficult situations. Sometimes with some very difficult patients, and I always say the most difficult patients are the ones who are asymptomatic because they feel well. But I always tell people, for the average Barbadian who's listening tonight, there's this thing about people who are asymptomatic. But I will warn you, you're asymptomatic until you're not. And when you're not, that's where the difficulty has come. And I would also caution Barbadians, this whole idea of asymptomatic people, which of course account for more than 80% of the population of people who actually have COVID. But I would say that many of the larger countries have a different process, which is basically people go home and if you get sick, you come back. And I think if you watch enough CNN or Fox News, or I hate to call news outlets, but any of the news outlets out there, you'll recognize and you'll see that by the time people often come back, they're often quite ill. So I think one of the beautiful things why I think our rates in terms of deaths and complications associated with COVID is really on the lower end of the scale, certainly since April, is because of the phenomenon of watching people, seeing them moving from that asymptomatic phase to a symptomatic phase. At that particular point are very capable and hardworking ICU consultants, Dr. Hassel, Dr. Lovell, really working with those patients at that particular stage, implementing some of these drugs that you see online, whether it's remdesivir or dexamethasone. We're starting the management of those patients at that time and we'll be able to pull them back. And over the last couple of weeks, just for a bit of information, we've had people who've been sick. And I think there's this notion that young people do not get ill. This has certainly not been the case over the last few weeks, where we had one or two younger folks getting ill, but we're able to pull them back. Additionally, for an update, in the primary intensive care area, we have 3 ill people. So those particular 3 ill individuals who are stable, but they're classified by us as severe COVID. We have 2 Barbadians there, and one who actually lives in the US. One who's actually here, and then a visitor from the UK. I would say that they're stable. We implemented our initial management on establishing that move from asymptomatology to being symptomatic, and one presented certainly symptomatic, the one from the UK. So we continue to work hard. It has been very difficult for us, very challenging for the staff, sometimes challenging patients, but I think they've put their best foot forward, and I think the ultimate aim for us is to get everyone back to their families safely.
Can you tell me anything about any of these prison officers who were in isolation or quarantine? Has any of them shown any deterioration in their condition?
Okay, so a great question. Thankfully for us at the facility, we've been monitoring them. So I think it's still quite early days for some of them, but most of them have just had very mild symptoms. So they often loss of taste, loss of smell, sore throat, for example. But these are all indicators of things that we need to follow. And some of them may have come asymptomatic, but then have developed very mild symptoms. And of course, that can progress. This is the importance of what I said before. And I often know the public say, they're asymptomatic, I don't need to be here. But I'll tell you from our experience, people will move and it happens very quickly. Sometimes within hours, you'll see a patient in the morning, you round on them, you see them and they're fine. And by the evening, we're scrambling. So I think we want the general public to understand that concept. And I take the opportunity at this time, as you know, I encourage the public through these difficult times to say, look, wear your mask. Wearing your mask doesn't only protect you, it protects the person in your house, it protects your neighbor, and it protects us as healthcare workers. Obviously, the less patients we have to see, the less risk exposure to us guys who are really flat out on the ground with the guidance, the help, and the support, certainly of the Ministry of Health and the government with the great facility that we have. Thank you.
I thought that when the Prime Minister introduced you, Dr. Ford, it was a kind of segue on the question of the demographic makeup of who is at Harrison's Point. From what you are seeing there, especially over this period, Christmas, New Year's, what have you discerned about how people have been enjoying themselves to their detriment? What are you seeing about this demographic makeup? Because all we are hearing about is the people who were who went on the bus crawl. But other people tell me that a host of other people got tested yesterday as well. So what are you seeing where you are?
Okay, so what I'm seeing on the ground certainly is exactly what was said on the call. So obviously you have local Barbados prison officers. We have people from the West Coast and often all the other contacts as mentioned previously by the CMO. I'm not going to get into numbers. I think that's unimportant. But I think what we're seeing as well as younger people as well within that group. And that goes to what I said before. I think there's this thing about COVID and young people are often okay, David, and certainly although that might be true to most extent, it might not be. I think one of the things in Barbados I would not like to see is one of our young people within the community. You often focus on the older folks, which is good, because they can overrun your healthcare system if you have a lot of elderly, but certainly to focus on the young people out there, say, look, wear your mask, wear these things. It might not affect you to hurt you, but it might hurt the person who's next door to you. It might very well hurt one of your family members who are vulnerable.
And the social makeup right across the board?
Social makeup right across the board. The rich, the poor, the famous, the not so famous. And this is important to note. I think the important point is that we have a system in place, and it doesn't matter how rich you are, how poor you are. I'm not a rich fella. But how rich you are, how poor you are. And I'm glad the Prime Minister said the thing is, look, you're going to come to Harrison's Point for that assessment. And that assessment is important because it allows us to benchmark you and put you in a category, maybe 24 hours, maybe 48. You may not like it. It's not Sandy Lane. It's not, I hate to call names, but it's not Sandy Lane. It's not, Ritz Carlton. But for sure, we have a dedicated set of medical staff there who function. So it's on a difficult situation.
There's a person here called Miss Phillips from St.
Hey,
Philip.
David, before you go to Ms. Phillips, please, if I can, 2 points. One, Barbados's permanent representative to the United Nations, Liz Thompson, got ill. She went to Harrison's Point and she spent 22 days there. And I think that it is important that everybody understands that we carry people to Harrison's Point not to be punitive, but it is critical based on what Dr. Ford said for that initial clinical assessment. In other countries, they're sending them back home and only taking them after they become symptomatic, in some instances, too many symptoms. So that the protocol that Dr. Ford has advised that the government of Barbados use has been fully embraced by the government, which is everyone bar none. From Mia Motley back down, from Her Excellency, the Governor General, if it happened to her, back down to anybody who is literally homeless in this country will have to go. Visitor, local, have to go to Harrison's Point for the first 24 to 48 hours, depending on the clinical assessment to be made by Dr. Ford. Okay?
Prime Minister, here's a
question. This person says to me that they're hearing that magistrates are in quarantine, including the chief magistrate. Can you get confirmation on this? Have you heard anything about this?
As the Attorney General is here, let him come. But while he does that, there are two other things I want quickly to do. Dr. Ford, I'd like you to speak to whether being in the same room as somebody with COVID immediately puts you at high risk, or whether the wearing of masks and the physical distancing and sanitizing and face visor, if necessary, significantly reduces that risk. And then I'd like to ask Minister Walcott to update us, because he was actually able to get significant progress on the matter of the call center with one of the telecommunications companies, and he can update us, but did not have a chance to update Minister Bostic yet. Please, Dr. Ford, thank you.
So I think in answering that question, first thing I'd like to say is to all Barbadians is, look, COVID is spread, we know it's a droplet, but also by contact on surfaces. And I think I will start there and given that understanding. If you're in a room with a person with COVID, I could stand in a room with a person with COVID, and once I have my mask on and I use the appropriate hand sanitizer, which is graded, then it puts you in a state to decrease your risk. It's like what we do at Harson's Point. You know, people are afraid when they say, "Oh, I work at Harson's Point, I don't want to come next to you," which is, you know, the way how it almost was when HIV started. The truth is, the reason why you're doing these protective measures is to stop that spread from you. So I could be in the same room as someone who has COVID. But once I have my mask on, it decreases that risk of transmission to myself. Once I use the appropriate hand hygiene with that greater than 60% alcohol solution, because that's important, then you know, your risk is reduced. Certainly by wearing a mask, at least more than 80% reduction in transmission from that individual directly to you. I think when you add a visor to this now, certainly in a clinical setting or even in a setting maybe in a barbershop or a cosmetic area, it further decreases your risk because you're now in direct contact with that individual. So although the mask is okay, by adding the visor, basically you reduce the risk even further, because now what you reduce is that influx maybe into the eyes, for example, or directly into the nose, and that impact. So I think it's important, and I really want to emphasize the fact to all Barbadians tonight, in a time in the country where you know we're under a bit of pressure. Certainly, I advise you strongly to follow the guidance of the Ministry of Health. Follow the guidelines. Wear a mask. It's not a joke. And anybody can be affected, from myself to my staff. And I keep saying, if you follow these protocols and follow these guidelines, it also helps us certainly in the healthcare sector. We talked about.
So why don't you make it mandatory?
So mandatory is interesting. That's a policy decision.
Okay. So that's not your call. That's the Prime Minister. That question is to the Prime Minister then. Why is it that in all these circumstances, if it is so important, why can't we make it mandatory, Prime Minister?
Only because in many instances there are as many doctors and medical people telling us that there is difficulty for some persons to breathe. And what I've also learned over 30 years of public life is that when you make things mandatory, people then get penalized and criminalized for the breach itself as opposed to the substance. And to that extent, we have strongly encouraged it. We've seen a large increase in the usage of it. I am disposed, I must tell you, to have a conversation about making it mandatory for indoor activity. But by the same token, for outdoors, I think that the medical people have sufficiently said that the risk is far less there. So that's where we're going in the conversation, David. But at this stage, we need to have some more consultations. I know, and I'm not fooling you, I literally distance myself from most people because, and I don't know whether it's because I'm a former smoker or whether it's because I'm overweight instead, I've lost weight but still overweight, that after a few minutes of talking with the mask on, I start to hyperventilate. So that I am sympathetic to those who do, but once I'm inside or in close proximity to people, I will wear the mask. For a press conference like this where I know I have extensive talking, I've deliberately asked for it to be set up, and I'll ask the cameraman to pan so that you see that there's nobody immediately around me, literally in this living room, simply so that we can do that. We also changed the rules of Parliament, the standing orders of Parliament, so that we can further reduce the density and allow persons to speak in Parliament virtually, just as we are doing here now. But I do accept that we may have to consider for at this particular point, and certainly until we reach some level of vaccinations, ensuring that persons within buildings wear masks or visors, depending, because in some instances the visors may be appropriate. Okay? Could I ask Minister Walcott to address the issue of the update, unless, David, you want me to address the two Barbados's issue anymore?
No, the two Barbadoses we can come back to, but we had this question which I posed about the magistrates. And before we do that, before we go to the AG, this lady has been waiting for a while. So I think we need to take a call from her. Ms. Phillips, good evening, and I apologize for the length of time that we've kept you waiting.
Good night to everybody and to the Prime Minister. I want to say thank you for doing such a good job. My question is to the Prime Minister, is everybody is talking about the bus crawl and making it seem like the prison and the bus crawl is the reason we have what we have today. But I'm seeing from Mr. Corey that he had just said that we have droplets. But yet still, we as a people, we had races, we had categories over the holidays. So I'm saying all of these people cannot only come from the bus crawl, and that is what I really would like to address to the Prime Minister. We are saying it's the bus crawl, but to me, we had races and we had children. And Corey is concerned also about the younger folks outside in this environment where we have all of those activities.
Ms. Phillips, can I ask you, how do you feel about it in terms of the signal it sends as to whether we have two Barbadoses or not? Ms. Phillips, are you there? I don't know if she dropped out. But given what she has said, there are others who may very well interpret that to just to underscore this notion of how one set of people are handled.
I feel in my mind that there. Yeah, please, I'm here.
Yes, good. Go ahead. Go ahead. Yes, my point is that we can use your question or comment as a foundation for that premise, which I think the Prime Minister is eager to address. So you tell her how you feel.
I am saying that
You're listening to the delay or something like that, and it's creating a problem. So stop listening to what is happening in the background. Otherwise, we may very well have to, curtail.
I feel that we as Barbadians have to be treated equally. We are not being told the Pacifics. You all are holding back. Hello?
Yes, go ahead, ma'am. The technical challenges that you're facing with this call suggest that we may have to move on. But I think the gist of what Ms. Phillips is saying is heard. That coming out of this, there are those people, Prime Minister, who feel as though, some people's names get called, some people's background, the bus crawl, it stands out for some. The people in the villas, as you spoke to that earlier, but I think you want to expand on it further in light of the kind of sentiment that you're hearing from this caller.
If I may, thank you, David, and I'm glad that she's called and asked the question so we can answer it frontally. The bottom line is, when we spoke to the bus crawl last week, it was not from a punitive perspective. And I think I remember saying specifically that now is not the time for blame. We spoke to the bus crawl more from the point of view of getting persons to come forward and to allow us to get ahead of the virus by finding out where it had gone. And why? Because in a bus crawl, persons are concentrated in a small enclosed area for the period of time that they're driving. Secondly, they tend to gather together at the shop where they stop. so that there is an enhanced risk with respect to persons who were on it. It was not and has never been indicated that that is the core or the patient zero. In fact, Minister Bostic has made it clear that we've not yet found the index case. He said so on Saturday in the press conference as well. So if Barbadians and some Barbadians believe that we are trying to make scapegoats out of the bus crawl, that is not the case. But we are asking Barbadians to realize that anywhere where you got to small up yourself, or anywhere where you have to go in an area which is tight, is going to put you at an enhanced risk as opposed to being out there in the open air, as opposed to being on a cricket field or being in the beach. So that is clear. Having said that, let's talk some straight talk here now. This country has not yet come to terms with issues pertaining to race. And that is one of the things that I have found that as Prime Minister of this country, that even as Minister of Culture under Owen Arthur, when we did the National Commission on Reconciliation, that this is an ongoing piece of work. And that is why I've asked Trevor Prescott to come into my office along with Rodney Grant on reparations, because as we work through the issues, there are some deep-seated issues that we need to be able to deal with. By the same token, when I put the facts on the table, this government has done more to be able to assist persons who have no voice or who have had no money or no opportunities than almost any. And it started even before we became the government, when we said that we were going to increase the pensions of persons who receive non-contributory pensions from $145 to $225. We were told it was impossible, and hence my statement, give me the vote and watch me. When you go through it systematically, we have not identified anybody because we want to put people out there as Bajans. I'm a Bajan. In fact, everything I have done in my life has been to uplift this country. And let me be specific, to uplift black people. I am a Pan-Africanist too. But being a Pan-Africanist does not make me a racist. And therefore, we have to begin to understand that when we invite guests into our own country, that we need to treat guests properly. If we invite guests home, we treat them properly. But equally, that does not mean that we've come to terms with some of the complex and deep-seated issues that separate black people and white people in particular, but also Indians and Chinese we've seen in this whole thing. And we've also had to address it in terms of religious differences too. So that I don't believe that this is going to be solved overnight, but I do want to appeal to Barbadians, because we can't end up with a love-hate relationship with the thing that employs the most Barbadians. And 50% of what we produce in this economy is literally driven by the fact that people visit us, stay with us. As a result of increased numbers staying with us, it means that farmers need to rear more pigs, need to rear more chickens. In fact, when tourists stopped coming, remember we had a glut on the market with respect to livestock. Similarly, with respect to other goods and services produced in this country, if less people are working, then it means other Barbadians who are doing manicures and pedicures, who are selling services, who are offering services, ironing or pressing or cleaning or laundries, all of these things are affected because for over 70 years, in fact, Barbados has had a tourism sector since the late 19th century, up at the Crane, 1890, I can't remember the exact year. But for the last 70 years or so, since Grantley Adams established the Barbados Tourism Board as it was, which the Barbados Development Board, as it was, which dealt with tourism and manufacturing, we've seen tourism escalate completely in terms of the contributions that it makes to this country. And it's not just Barbados, it's almost all of these small island states. And invariably, the states that have tourism have a higher level of GDP per capita income, so that persons earn on average more in countries that have tourism and services than in countries that rely on agriculture and commodities.
Okay, thank you, Prime Minister. Now, there's a question that I want you to address, and it has to do with this variant coming out of the UK. The last time I heard somebody from the administration speak about it, they said that they needed to get help from PAHO, WHO. To many people, recognizing whether the variant is here or not is a matter that is considered to be urgent. How soon do you think we are going to be in a position to get a better handle on whether it is here or not?
Mr. Walker will address that question for me, please.
David, I think you mean me. I spoke about it, I believe it was 3 or 4 days ago. I said that we had sought assistance from PAHO in terms of having the genomic identification and testing done. I've subsequently discovered that CARFA is offering that service, and we're making arrangements for samples to be sent to CARFA as soon as possible.
Thank you. And
This,
to
David,
the AG, sorry.
one key point, because I think that there's a lot of comments about the strain. All of the evidence shows that the strain is not the first mutation of the virus. In fact, there have been, I'm told, at least 4 mutations of the virus since the start. But that this particular strain has been around since September. Now, we can get into a conversation as to why it has taken preeminent position in the last few weeks or not, but that is neither here nor there. What is important is that the protocols to fight it are the same, the therapeutics are the same to combat it, and the individual actions that we must take are all the same. So whether it is old virus or new virus, it is the same virus that we have to fight in the same way in which we were fighting the old one, we fight the new one. And I think that's the important point.
I think the another important point is how contagious it is. And that contagion has implications for our capacity to deal with numbers. So that's another reason why we need
Except that fighting it is the same thing that Dr. Ford would have said. That's all the more reason why we are saying to persons, you have to take the individual actions to protect yourself, whether it is old or new virus, because even though it may be more contagious, it equally, we're told, is less lethal. But that is neither here nor there. What matters is what are we doing to protect ourselves from the old or the new strain, period. And he is free to add to that if he wants.
Okay, AG, this question that was posed by someone here about magistrates and whether there are magistrates in quarantine. Can you enlighten us as to what the situation is there? And you also have to tell us about the courts, because people have been asking about what's going to happen with matters that are before the courts in the coming days, especially going down to the 14th of January.
Yes, thank you very much, David. Good evening to all. I need to say at the outset that it has always been our policy that the identity of individuals who are in quarantine will not be made public. You might recall that at the very outset, when we had patient 0 at Paragon, one individual quite mischievously did a videotape of the persons there at karaoke, having a karaoke to entertain themselves, and sent it out. That caused the individual who was seen on the particular footage a tremendous amount of discomfort. She and her family members received a lot of hostile calls and even tending towards threatening. And as a result of that, we therefore made a determination that individuals who are in quarantine, their privacy will be respected. So I will have to respectfully decline to give any information on anybody. In relation to the courts, I think we addressed this in our last press briefing. Obviously, in relation to matters that are criminal in nature, it will be impossible for those individuals to come down to either the magistrates' courts or the high courts to have their matters heard. There's, in recent times, in fact for quite a while, been a practice of allowing certain kinds of applications to be done by Zoom so as to eliminate travel. But in this current situation, even to accommodate that kind of process at Her Majesty's Prison Dodds would represent a challenge and unwarranted interaction between prisoners and also the prison officers and so on. So I've had a discussion with the Chief Justice, who has agreed to meet with his criminal bench, and I believe that that is the practice that is going to be followed. In relation to the civil courts, there should be no interruption of court activity as a result of this situation.
Okay, and a question relating to sandals. Someone says nothing has been said about them. What is the update on sandals?
far as yeah. In terms of sandals, I convened a meeting last week. As you know, Sandals has been informed because of repeated issues and in breaches internally of the protocols in terms of Sandals, and they were delisted with effect from tomorrow. I met with Sandals management and officials from the ministry, and we looked at Sandals came with a plan in terms recognizing that there had been some breaches. They recognized that, and looked at how going forward they could improve certain of these measures. I'm informed by Mr. Ronald Chapman, who is in charge of the monitoring unit, that as discussed, they paid a visit again to Sandals on Saturday. He's informed me that there have been substantial improvements, and they will continue working with Sandals so that they meet again the requirements of the Ministry of Health and Wellness.
That's another call, and you just need to remind me as to how much more time we have. We know just after 8 o'clock.
We have Anne from St. George on the line.
Anne from St. George, thank you.
Hi, good evening. Can you hear me?
Yes, Anne.
Hi, good evening.
Good evening.
Directed, I think, to the Chief Medical Officer. And this is to something you asked quite a long time ago.
This call is fluctuating in quality. Speak up a bit, please.
Yes. So my question regarding a topic mentioned a time ago. This is the 4 to 5 day retesting that you brought up, Mr. Ellis. And I actually am calling to support your position. And let me explain and give some science behind.
I have great difficulty understanding what is being said in the call because it's fluctuating too much. I'm hearing part of it, and then it is drowning out. It's going out. Yes, go ahead.
Yes. So my question is to the Chief Medical Officer. That repeat testing at day 5 post the first test, that is only valid in people who are sequestered, cloistered, or quarantined. In fact, this is exactly what they're doing at the prison. They tested them 1 day, and 5 days later, they'll test everybody who's exposed. This is extremely valid, and it's based on the science. I have the article. I can discuss that. But regarding people who are trapped,
just hold on. This is hard to pursue. I don't know if anyone on the panel is clear on what has been said in the first part of the comment which has been made, and would want to respond if you have been able to decipher exactly what said. I know you got more to say, but let's take the first part of it. And
I have to complete because I'm saying
the problem with the problem is that we can't pick up clearly what you're saying. Okay. Unless you try to call us back or something, because it's very difficult. It's just fluctuating too much. Or send me if you can, send me a WhatsApp on it or something like that, so I can repeat it for you. All right, but it is difficult to pick up exactly what's the question.
Does this help?
Pardon?
If my raise my voice,
no, it's not your fault. I think the problem has to do with the line itself. So let's move on to Sarah from Christchurch and see whether we can get a better line from her. Sarah? Sorry about that, Anne, but let's try again. Yes, hi, good evening.
Hello?
Yes, welcome. Go ahead, Sarah. We're listening.
Hello, Sarah here from Christchurch. So my question is, what are we doing with the person who recorded what was going on his Instagram page about the quarantine facility at Hudson's Point? What are they doing with her?
I think this was a visitor or something like that, who made some very disparaging comments. Does anybody want to deal with that?
What are we doing with the person who was in quarantine at Hudson's Point that made the Instagram page?
That's a different question. Yes, go ahead. Who's going to take that? Dr. Ford, you? or is that something for the AG?
Well, I don't know that it's something specifically for the AG, but I think it's in a way connected to what I spoke about earlier. Because of what has happened, we are extremely concerned about protecting the identity of the individuals. At all times, the directive will govern the kind of conduct. What the directive says is that no person may transmit from any location or quarantine, any location of quarantine, any videos or photographs of individuals who are in those places. The point is, you want to protect the identity of the individuals. As I understand it, the individual in question made a number of comments about our quarantine. Barbados has never been a place that engaged in censorship. We've never been a place that rejected or refused to accept criticism. There are objective standards that we are satisfied we've met in relation to our quarantine facilities. She may have a different view, but there's no element of our law which will allow someone to be prosecuted purely for expressing a view that they don't like what we offer. The central issue would therefore be whether the individual has breached any part of our directive, and our directive seeks at all times to protect the identity of the individual who is in quarantine.
I want to address this issue of persons breaching quarantines too. I asked for a report before I came here. There are actually 10 people who have been charged for breach of quarantine. And I want to put it in context because the truth is we have over 15,000 persons from Britain here alone. I don't have the numbers for Canada and the US, but we've had thousands of persons come in. We've had 10 breaches of protocol. There are 10 too many breaches of protocol. I've spoken earlier about the extent to which persons who are our guests, while we will treat them with respect, they must equally treat our laws, our mores, our customs, our directives, our people with respect as well. To the extent that there were 10 charges, 4 of them were Caribbean people, including Bajans coming home, and 6 of them were non-Caribbean people. So I think we can safely say that it was more or less even with both visitors and locals and regional people not adhering to the directives. That means, what does that tell you? Every lawyer in good, every lawyer in bad. Every doctor in good, every doctor in bad. Every short person in good, every short person in bad. But what we have to do is to hold people to account. Now, it may well be, and this is why I said that the emphasis on the bus crawl was never punitive. The emphasis on the bus crawl was one in relation to finding persons who had literally been involved in it, because we recognize that they pan out across the island more than most. But secondly, that we also wanted to ensure, and a time will come where public health will tell us whether they follow the protocols or not. Regrettably or otherwise, like with most other things in this world, social media now comes to dominate. And therefore the explosion on the bus crawl didn't come from the government. It came from the explosion of video being distributed. And then I think the horror of persons that the name of the bus crawl was the name that the AG sang. I don't want to be put on a TikTok video like him, so I won't quote it. But the name of the crawl, that was the extent to, I think, people's shock. But it is not that the bus crawl was at the center of it. I was equally appalled, and as a result of it, gave instructions for us to have a meeting last Monday with persons who were involved in pleasure craft because of the raft up on the West Coast. It was reckless, it was unacceptable. And in fact, I don't even want to speak anymore about it because I don't know whether the COVID unit will take action or not. So I'm not getting into prejudice in these matters. But suffice it to say that we are trying hard. And some people I hear take offense at the fact that I spoke in a maternal way, as if I was chiding people. I don't believe that Bajans are little children, but I believe that Bajans can relate to conversation and logic and people talking with each other. And that's all we're trying to do. So for example, one of the things that we're saying, restaurants can stay open, but we don't want people congregating at bars or in rum shops. Go in and buy what you need to buy and come out. And we feel that, and I've always said it, Bajans learn more by example than by instruction. And that's why you see me sometimes, like the other last time, showing what it is. Not because I believe that everybody needs that example, but remember, when we hold these press briefings, we're not just talking to persons who have degrees, we're also talking to people who may want further explanation. And this is not meant to be looking down on anybody, but you will notice that when I speak, I try not to use big words. Why? Because this is not about me. This is about effective communication and people understanding what we are trying to say. So I hope that this in some way gets us to recognize that we will hold people accountable. As the AG said, you cannot have a problem with somebody because they have a different opinion. Verla de Pisa has a different opinion to me. Other people have a different opinion to me. But that does not mean that their opinion is wrong and mine is right, or mine is wrong and theirs is right. What we do have, however, is a recognition that if you step on the crease with respect to the actual protocol or the actual breach, then you must be prepared to stand accountable for your breaches, regardless of who you are.
This person writes that I would like clarity on transportation from the COVID unit, as they put it. Persons are saying that when they mention the need for transportation, they're being asked to take public transportation. And the Facebook page is saying not to take public transportation. So they want to know, what's the official word on this? What's the protocol?
I discovered that persons were being asked to take public transport, and I literally must confess, I intervened and vetoed it. And I've said money cannot be an issue. If persons feel as though they really are under stress, that's why I think we've made 2 transport board buses, Minister Walcott, Minister Bostic, available to the Barbados Defence Force, in addition to the ambulances, so that we can also try, and we will put more, obviously because in these last few days we had increased demand. But I want to say, David, publicly, and it's important because the people at the Dos Santos lab have worked beyond the call of duty. And even with the testing there and at all of the polyclinics, considering the thousands of persons who first had to be tested and swabbed and then running the tests, I think for the most part it went smoothly. Minister Cummins met with the taxi drivers, I'm told, yesterday as well, because we recognize that we need to remind and strengthen protocols in every respect. And this is not to single them or anybody else out, but I've given a directive that every one of us, from the cabinet back through to the operational elements, in everything in life, you can always do better tomorrow. You reflect on what you did today and let us see how we can do better tomorrow. So I hope that that will help us. And as I said, this example will show Barbadians. And as I moved around the country the last few days, I've seen tremendous adherence to a lot of what we've asked Barbadians to do. And I really want to thank you. I could be leading a country where this level of compliance is simply not there. Fortunately for us in Barbados, due to our system of who we are and how we've been educated and nurtured, for the most part, Barbadians from every background will engage and will participate once they realize that the matter is serious at hand.
Someone wants you to clarify whether sandals is still delisted or they're back on the list.
I said so just now, David. I thought they'd heard. I indicated it's still delisted. They're working with the officials in terms of delisting as a quarantine hotel. Not for regular stay. Sorry.
What are you requesting of them, if you can tell us that?
There are certain breaches that occurred, have been reported to the ministry by the COVID monitoring unit, that occurred at Sandals over the past few months. And there have been some improvements, but not to the satisfaction of the ministry. As I said earlier, we convened a meeting last week with the officials from both sides, and there is a commitment on the part of Sandals to separate. I believe they have 2 properties, to use one as a dedicated quarantine center, and they've said that they would do certain things in terms of securing it, that there will be no mixing or mingling of persons who are not in quarantine with those who are in quarantine. And the ministry paid a visit on Saturday, the ministry's officials. They say that substantial work has occurred, but there's need for more work to be done. And the ministry officials will remain engaged. That is, officials from the COVID monitoring unit will remain engaged with the Sandals group in terms of bringing it back in, getting it off the list as soon as possible. But as it stands, it is delisted as it relates to providing quarantine facilities.
Jamal from St. Michael, what's your question?
Hi, good night to everyone on the panel. Thank you. My question is this. In terms of the promoters and these events that have come under scrutiny recently, were there instances where the promoters are following all the protocols? You're doing everything you're supposed to be doing. You have the sanitizing station set up. You have the no mask, no entry protocol. You're taking temperatures. And then after the people get on the inside of the venue, they now choose to remove their mask. You have your DJs or your persons reminding them ever so often, and they continue to do basically what they want to do. You know how Barbadians are sometimes. I think COVID-19 unit shows up or something, or video or some kind of other recording is released of the event of people not doing what you're supposed to be doing. Then the brunt comes back then at the promoter. What really is the promoter to do in situations where they're following all the protocols and people are just doing their own thing?
Do some promotion myself, and it's a difficult situation. Similarly difficult to a Minister of Education or an Attorney General, because you're responsible for the actions of large numbers of people on you. You can't know what they're going to do before they do it, but as soon as you know that somebody's doing something wrong, then you have to intervene. In some instances, if it is an event with music, you may tell the music shut down until people come back down and cease and settle. In other instances, like with the bus crawl, you have to absolutely make sure that you're not breaching densities, although the AG has correctly indicated that he would prefer that we hold off of bus crawls because of the dense nature of persons sitting in a small space. In fact, one of the reasons why we ask people to do remote working more than anything else in the public and private sector is to reduce the pressure, and why we also don't have it in the schools, schools going out to school in these 2 weeks, is that we want to reduce the pressure on public transport wherever possible, because we recognize that that limited space has the potential to become a difficult area to manage the virus in, especially if persons are not adhering to the reduction of density in the protocols. The other thing, of course, besides changing the music, you can stop serving drinks at the bar until people come down. There are a number of things that you will have to do sometimes to tell people cease and settle. And you may have to go on the mic and do it yourself too, if you have a mic. So I'm sensitive to your issues, but equally I will also want to say to you that promoters carry the same burden as employers, whether that employer is government or private sector, or owners like the same Sandals, etc. The owner may say, I didn't know what the people in the hotel were doing, but that's no excuse. So that we all take responsibility for the things that we have control over as owners or as managers, regrettably. And it therefore means that there's a greater burden on us to monitor and to ensure that we are in a position to minimize or eliminate where the challenges come.
Another person here is saying, look, we want to get some clarity as to reports that some workers who are awaiting their second test are being told to report to work in the interim pending those second COVID-19
They should
tests.
not. They should not. They should not. And I want to address one other issue too as it relates to workers, and I thank you and the person who raised it, David, for reminding me. Bottom line is I'm being told that some workers are being told that the period of time during quarantine is to be deducted from their sick days. I think that that is highly unfair. The workers who invariably, in not every instance, but in most instances, who were exposed were not exposed because of their being reckless or their being somewhere where they should not have been. In 95% of the cases, it is because they were simply doing their job. And to ask them to have to pay by having their sick leave deducted such that when they really need it, because in most instances, I must tell you, the majority by far of the tests have come back negative. So it means that yes, they've been forced to stay at home for the 3, 4, 5 days, whatever it is, But if you deduct that from their sick leave allocation, then when they really are ill and need it, especially at the start of this new calendar year, it's not going to be there for them. So I hope that this is a matter that the social partnership can engage in between the private sector, the Employers Confederation and the unions to ensure that we can have clarity across the board with respect to it.
This is a major question. Schools, what's happening in light of these latest developments? What is going to happen?
As I indicated, the Minister of Education will speak to you, but for sure there is no school going to take place in Barbados between now and the 14th of January. I think I'd announced that last week, but I expect that during the course of this week, Minister Bradshaw will have her conversations. I'd be surprised if we would be in a position to do it from the 14th of January. We just took that as the first stage because of that. I expect that there will probably be further delay at this point in time, given what has transpired.
Okay, let's take another call. Who do we have here now? Is it Mr. Walcott? And let me apologize to Anne from earlier. While I was having difficulty hearing the call and making out exactly what was being said, other people reported to me that what they were hearing on radio was quite fine. So, Anne, I apologize to you. Mr. Walcott from St. John?
Hi, good night. We know that geofencing can be hot, and it only takes another person to test the current security to bring us back to where we are now. Some of us past and present members of the security forces were privileged to be trained to provide security in a state of emergency. Security guards at quarantine sites are not trained to do so. Why, if we are in a state of emergency, points of interest such as quarantine sites are not secured using BDF personnel as sentry to ensure there are no breaches?
I think I lost the last sentence. I heard the part about persons being trained. I'm suspecting that you're saying that we should use more trained personnel. Is that what you're saying?
What I'm saying is that some of us past and present members of the security forces were privileged to be trained to provide security in a state of emergency. Security guards at quarantine sites are not trained in internal security. Why, if we are in a state of emergency, points of interest such as quarantine sites are not secured using BDF or Royal Barbados Police Force personnel who are trained in matters of state of emergency, and were they not used essentially to secure these sites to prevent breaches?
I think I take your point to be that security companies should be encouraged to use persons who have higher levels of training in more sensitive sites. I've gone beyond that. I've said two things. One, that the isolation and quarantine hotels need also to have reinforcement from and monitoring from the Royal Barbados Police Force as well as the Barbados Defence Force. But I've gone further. The National Security Council has agreed that in these times that both the Royal Barbados Police Force and the Barbados Defence Force should seek to enhance their numbers by ensuring that persons who have retired and who are not in the vulnerable group but who can still give service ought to be encouraged to come back in to amplify our numbers as we go forward in these difficult situations. The other thing that has been discovered is that in some instances people are given wrong contact information, wrong addresses, etc. And therefore we are going to be tightening up on what information has to be given. But more importantly, I think that when we look to introduce the digital ID card, which we have expedited because we want to move to, as far as possible, a cashless society, because cash itself becomes a medium for the virus as I understand it. We are also going to have some conversations as to what are the obligations of citizens with respect to the provision of accurate information on their address, particularly in areas where it is required. But we are in a position to use access to other records with the appropriate matters, provided that there is a law enforcement issue that needs to be pursued in order to be able to access persons' records. You can't just access them just willy-nilly, so there has to be a legal framework within which it can be supported. So I hope, sir, that persons like yourself, if you are not working or are capable of working, can come forward and enhance the numbers of the Barbados Defence Force and the numbers of the Royal Barbados Police Force as we work together with existing security companies to tighten our enforcement across the board in every instance. And I think that the Ministry of Tourism and the BHTA understand that the more that we can concentrate efforts, the easier it becomes for us to patrol and monitor and enforce. The other addition that we've put in place, which was not there before, is the use of drone technology, particularly for the outdoor spaces where people are gathering. And between the Royal Barbados Police Force and the Barbados Defence Force and private drone operators, once again, we are in a position to be able to enhance the surveillance capacity of the country way beyond that which was happening before.
Simone.
Hello.
Yes, good evening.
Hi, good evening. A blessed good night to you, Madam PN, and the officials there. I have two things I would like to discuss. The first being the hours of operation at the polyclinic. We were told by the AG, I believe, or it was the Minister of Health, that the polyclinics would be open from 8:30 to 4:30 for testing Sunday, Monday, and Tuesday. Yesterday, I would have gone to Oyson's clinic at 3:58 and was told I have to come back tomorrow. They cannot do any more testing. I said, all right. Today, I went again at 2:30 and was told they are done for the day. I have to come back. I told the lady I have walked here a second day. I would like to be tested. She said, fine. She tested the person I was with, and then 6 other people came in after me, and she wanted to tell them they cannot be tested because they're done for the day. So I am trying to understand how the ministers can see the hours of operation are 8:30 to 4:30, but this particular clinic is taking it upon themselves to close the clinic when they see fit. My other question would be, would it be safe to say to limit the amount of private villas or hotels that tourists can self-quarantine in to kind of help with tracking those who may break quarantine or may not break quarantine, or that will also help with securing places? If we have 10, we may not be able to help secure those 10 with those self-quarantining. But if we just have 2, it may be a bit easier. Those are my 2 points for the night.
Thank you, ma'am, and thank you for sharing. I'd like to invite Dr. George, the CMO, to address the issue of the times of the polyclinics, and then I'll reinforce what I said earlier about the hotels and the conversations that needs to take place between the BHTA, the Ministry of Tourism, that we're not yet finished having those discussions yet, but we're trending in that direction. Go ahead, please.
Thank you. The times for the polyclinic are 8:30 to 4:30 p.m. I will make some checks, and I endeavor to find out what was the issue at that specific polyclinic and try to take corrective action. Thank you.
And we apologize for the inconvenience, because that was certainly not the intention of either the government, the cabinet, or the CMO, or the ministry. And sometimes you'll learn after you've been in this for 30 years that sometimes you have gaps and drops where you don't expect to have them. But we have to do better each day and to raise people to a higher level. As it relates to the hotels, I don't think you'll see it dropping to as low as 2, and for the reasons that I explained earlier. But I do think that we can do a better job at consolidating in terms of what are those quarantine hotels and ensuring that the absolute rigor is applied so that they meet the protocols. And similarly, to the extent that we do have to designate hotels for isolation, the same thing, there should be a few in different price ranges, but just a handful, so that we can better monitor and survey what is happening, as I explained earlier to the gentleman who called with respect to former soldiers being trained. Thank you.
Question. It says they want to know if employees must be paid double pay for these 2 emergency bank holidays, since they were not on the table previously. The person continues by saying, as an employer with limited incoming income in this period, it is challenging to have 2 additional double paid days, having just paid 3 bank holidays, which I believe would be namely Christmas bank holiday, and New Year's Day.
It's challenging, but it was essential. I think all of us will agree that we want to make sure that the country does not have a situation running out of control where people are dying and where people are appropriately affected. And therefore, we took the decision in the national interest. I have indicated to those who have raised a similar issue to us that we are prepared to look at compensating people for the additional cost, and I think it's time and a half as opposed to double, and it would be the difference between your normal exposure and what you had to pay, but rather than doing it up front, we are prepared potentially to look at it as a tax credit or a tax allowance, so that when people are filing their taxes later this year, we can then look to offset it.
Okay. Let me see if we can get Barbara from St. Philip.
Hi, good evening.
Yes, good evening.
Yes, I have 2 questions. Good evening to the panel. I have 2 questions for the panel. And one is, coming out of this exercise, I've learned that you test first, and then in 5 days you test again. Now, I want to know how long the results for the first test are coming back, because I know people who tested over the weekend and they're waiting on the results. Is it that if you do not hear that you can go ahead and have your second testing when it's ready? Then I know of persons that tested and they have symptoms, high fever, coughing, and so forth and so on. They have the bags packed for St. Lucie, but they're not hearing of anything, and they were tested since Saturday. So I need to get some clarity on this.
Not sure if Dr. Ford, I think he wants to come back on, and I'm not sure whether he wants to take that question or Dr. George. Dr. Ford?
Question, because I have also discerned that some people have been waiting for a relatively long period to get back their tests.
Because of the scale.
I'll follow for you and have an added comment.
Okay. So, Dr. George?
Right, so we had some issues last week with respect to getting back test results, and then we got back on track to give back test results within 24 hours. Since the outbreak, since the local investigations are going on, there has been, as you rightly know, overwhelming response from the Barbadian public to be tested, and therefore we are returning test results between 24 and 48 hours again. Once this settles down, we will endeavor to go to returning results within 24 hours. Thank you.
Thank you. Dr. Ford, you wanted to speak, please?
Thank you.
Yes, I just want to make one comment for clarity. So when people are tested in parts of contact investigations, is one important thing to understand. So whether or not that person can go back to work depends on whether they're stratified under the protocol, World Health Organization protocol, as to whether they're low risk or high risk. So if your first order contact, meaning you had direct contact with a known positive case, and your first test is negative, then obviously you'll wait for your second test away from work. If you're a secondary or third order contact, which really is a low risk setting, for example, you just walk past the one in the supermarket who you knew was positive, but you had your mask on, etc., we consider that to be a low risk status. So there's a classification for that, which puts you into low risk or high risk. And based on that, decisions can be made as to whether or not people can go back to work. So it really depends on that scenario, whether you're considered to be a high risk immediate contact, like someone in the household direct contact, for example, on the bus crawl, for example, in the same building or working in the same environment, enclosed building, versus other scenarios where maybe a secondary or even a tertiary contact of another individual. And I think the important thing is if that primary contact is positive and then the secondary contact is negative, then you're kind of like cleared. So there's no real reason to be away from work. And I take the opportunity as well, and I didn't say it before, but I'll take the opportunity if allowed by the Prime Minister to say, certainly I need to take, I forgot in my comments before to say I want to commend the board and chairman of the hospital for the support given to the staff at Harson's Point at this particular juncture. I know they have been working very hard to assist us in every way possible. Thank you.
Corrected on that point, Corey, and I thank you for the clarification. So that's your answer, David, for persons who literally are waiting a second test, whether they're primary or secondary or tertiary contact. And I'd like to recommend that they contact the public health officials if there is doubt.
Rochelle, St. Michael.
Hello, good night. I remember the last time they had the shutdown. I had a really horrifying experience when my daughter was not feeling well. I had called the ambulance, nobody would come, no doctor would see her, anything like that. But my question to the two guys, especially when the Prime Minister had mentioned about dengue being on the rise, what measures are being put in place for persons who are actually not feeling well that might have some similar symptoms to COVID-19, and there's no, you can't go to the hospital, obviously. What measures are being put in place for persons like that? That's what I want to know.
And I would add to that, they need to tell us just how bad the dengue is.
But I'm not only talking about dengue, I'm talking about for the instance of somebody just not feeling well. And you know at this time you call in the doctor's office, no doctors will see you. You go to any emergency places now, everybody obviously is cautious of COVID-19 spread. And I mean you can't go to your emergency. So I want to know if there are any places that the government has put in place for persons just not feeling well that they can actually see a doctor.
Minister Bostic and Dr. George, I think the two of you are in a position to answer. Question related to dengue and to other conditions that people need attention for generally, that they're not being able necessarily to be assured that they can access medical support or attendance for?
The polyclinics at the moment, because of the weekend and public holidays, we've designated those days for testing in response to the situation that confronts us. But the polyclinics will reopen as normal so that those services can be had at those polyclinics.
Specifics?
Dengue, we've been tracking dengue. We're trying to do some confirmatory tests because the same PCR testing unit is utilized to do that. But we've also been ramping up our response in terms of identifying the mosquito breeding sites and also a number of fogging teams that we have brought on, and we are awaiting the arrival of fogging equipment from overseas, both fogging machines for trucks as well as handheld foggers, so that we will move to having 4 teams operating across the country, 2 in the north and 2 in the south.
So you're vague on exactly how big a challenge we are facing at the moment, no?
We have a big challenge as far as the ministry is concerned, based on the calls that are being made to people in relation to mosquitoes. But we are engaging with the Queen Elizabeth Hospital and across the polyclinic system to see exactly where we are with reports of dengue. The CMO would have reported before that we had a spike in October, I believe, and then it came back down in November. But as you can appreciate, we're trying to fight both the COVID, as we have been doing in December, and dengue. But we'll be in a better position to report on that in the coming days.
David, I was just going to make the point that as Minister of Finance, we took a decision back at the end of September to give the Ministry of Health significantly more resources to be able to deal with the dengue problem and the bush as we can see it. And it is a case of the entire country, however, coming together to fight this problem. It's not just a governmental problem. I've been a member of parliament for almost, and involved in public life for over 30 years. And I know that there was a time where people just took care of around them. So that even if you don't own the land, move the tot or move the thing that is collecting the water next door to you. Or in some instances, you may have to actually debush. Now, we are hoping that we can bring the legislation to deal with persons so that the appropriate fines can happen. But as you know, the AG has been under severe pressure with respect to the volume of legislation in the last 6 months because, as I've had to remind people, while everybody has the luxury of focusing on one issue, COVID or dengue, the government is not the government of COVID nor the government of dengue. The government is the government of Barbados, and it has multiple issues from economic to crime to health to whatever that we're dealing with. So I think that we will continue to do, the government, the Ministry of Health is using their resources, but I want to use this opportunity to reach out to Barbadians and to say that I believe that all of us can do far more if we seek to take responsibility for the areas immediately in our vicinity, even if they're not ours. Why? Because a mosquito does not see boundaries or boundary lines or any of that. A mosquito is going to breed and it is going to bite. And by the same token, I have a team of people looking to see what are some of the novel approaches that we can do going forward to fight dengue, because there are a number of scientific approaches globally that are attractive, but we are in the midst of doing the investigations now.
But Prime Minister, I mean, this whole presentation today has been to update us on the very significant issue of COVID. There is that creeping concern too about the dengue. So I think what's missing here is we don't have any specifics on exactly what you have been able to identify, the magnitude of the problem that we face with dengue, the extent to which we are fighting twin issues in this regard. So that perhaps is what I'm trying to get something more specific on.
Valid point, David, and I think in fairness, the others probably came here with the information top of mind for COVID, but I certainly believe that Dr. George and them can share with the public what we have been doing with dengue, how we amplify the resources in terms of both fogging. I think instead of 1 or 2 teams, we asked for about 5 teams to be deployed. Jeffrey can confirm if that's correct. 5 teams instead of 2. And secondly, we have doubled the number of workers as part of the COVID relief program, but also because of the enhanced rainfall during October and November. What used to be known as the 360 program is now known as the 720 program, because 720 people are going to work every day in this country now to help relieve us of some of the bush and some of the other things that have caused problems. But in spite of that, that will never be sufficient. And that's why I made the call to Barbadians, as they have done for decades. Just take care around you. Not only what you own, but when you take care of what is around you, then you're beginning to protect yourself. In the same way that we are asking you to do with the mask and the sanitizing and the distancing.
Okay, any other calls we have here? Let me see who's next online. I think it's there is Shaheen from St. Peter. Are you there?
Yes, please.
Yes. Go ahead. You're listening.
Yes, my question tonight is a reference the
water situation, as we have had a heightened sense of the COVID alert recently. My question is to the water. There have not been running water in the Moscowbell area since March last year. And how are then we supposed to sanitize thoroughly?
All
When
right.
we have to be on
I'm gonna get a quick answer to that because we're now running into a period where some of the people who are working on this project are gonna have difficulties getting home because of the yes, sir. I've heard your question and I'm gonna ask them to answer it. Which has to do with the water problems that some people are facing. But in light of the challenges that some of the people who are working on this project may face on the roads, it seems as though Prime Minister, we may find ourselves in a position where we'll have to curtail this session soon. So what do you have in mind, ma'am?
What I will do, David, is to arrange for Ian Goodinedgel and the chairman of the Water Authority to speak to the country later this week to give the gentleman the assurances that the government is working assiduously at being able to solve the water problems. It is a situation we inherited. It is a situation that requires a multifaceted approach. And I have every confidence in Ian Goodinedgel to be able to update the country so that I can give you that commitment on his behalf that he will speak to the country later and probably in a similar type environment where maybe you can facilitate him and jointly with CBC on a call-in type situation like this again, because I think this has really worked well this evening.
Give me a lot of work, Prime Minister.
No, so welcome to the club. But I thank you also at such short notice. I'm not fooling you. I want to thank you at short notice for coming to, yeah, you'd have, and to come in at such short notice to help facilitate us being able to speak to as many people as possible. I think the country will be glad that you've done it too.
David,
Yes, Minister.
and I want to thank you so much for being the moderator this evening. It's been very useful. You've first posed your questions, and I also want to thank those who posed questions this evening, and indeed to thank those who are viewing this program and also those who are listening to it. I think it has been extremely useful. We've heard from the Minister of Health and the CMO, and has been able to answer, and indeed Dr. Ford have been able to answer a number of questions. I know that there's still some other questions out there, but obviously time does not permit at this point. In addition, I want to commend and thank the Minister of Home Affairs who spoke as it relates to the situation at the Dodds Prison. And that is indeed a very difficult situation, but again, we seem to have it under control. I also want to thank the Attorney General for his participation. All in all, it has been a very useful process, and in terms of coming to Barbadians and speaking to them and responding to some of their concerns as it relates to COVID at this time. In a situation, obviously, we understand how persons might feel in terms of their fears, in terms of anxiety regarding the COVID, and having heard so much about this pandemic. At the end, I just want to say, before I hand over to Prime Minister for some final words, that it is a process, a slow process, in terms of the need to balance the risk assessment with risk mitigation, and indeed continue to communicate to all Barbadians the risk and the importance of certain vital things: wearing masks, hand sanitizing, physical distance. Before I hand over to the Prime Minister, however, for final remarks, I just want to make a comment that the Minister of Health and Wellness spoke earlier as it relates to the hotline. And while this program has been ongoing, I've been reassured by one of the providers that within 2 to 3 days, the whole system will be improved, where you'll have queuing of calls and automaticity of returning calls for those who might have been disconnected or got tired waiting. I want to thank all of you, and I want to hand over to the Prime Minister for her final comments and words to you. Thank you.
Thank you very much, Jerome. As Jerome just said, I want to say thank you to all who have participated. I really want to say thank you to him. I think that most people don't realize that we are blessed in Barbados to have a level of expertise in our cabinet and government that is unparalleled probably in the region. Jerome Walcott was the person designated by the Caribbean community to establish the Caribbean Public Health Agency. The Caribbean Public Health Agency is what has kept Caribbean countries above, their heads above water since the beginning of COVID. And in fact, in addition to Mr. Walcott being the person who set it up and established it for the region and hence understands how it works and its purpose, we are also lucky that another Barbadian, a former chief medical officer, is in charge of CARFA and has in fact been with us for most of the time since COVID and is available to us as she is to other members of the Caribbean community. I want to end where I started, which is first thanking Barbadians for your cooperation. That is absolutely critical to us being successful. If I in any way appeared as though I was scolding you last time, know that I love you. I ain't scolding you. I'm trying to get the best for all of us to move forward and to protect as many of us. We are in this together. Because of it, we are tightening up where we need to, and we will release a little pressure where we can. With the churches, I've said already, we will have a new directive that will speak to 10 persons being available to be in the churches or religious institutions as opposed to the 3, and we will carry the funerals to 20. If you want more than 20, you're going to have to write and apply, but we will be monitoring those who have applications that are necessary. We are going to enhance the numbers of persons involved in surveillance. I spoke earlier about instructions to the Royal Barbados Police Force and the Barbados Defence Force to use persons who are retired at this point in time until we can get through this period and until we can have a sufficient level of vaccination in the country, however long that takes, whether it is 3 months, 6 months, another year. We are adamant that we will enhance our surveillance to be able to suit the risk that is involved. We've also indicated that while restaurants can remain open up to the times before the curfew, and I spoke about that the last time, we are going to require persons not to congregate in either restaurants or shops. In other words, go in the shop, get what you have to get, be dispatched, go back out. If you're going to a bar, get what you have to get, be dispatched, and go back out. But we are not going to allow persons to congregate and line at bars at this point in time. I want to encourage persons, as I said, if you don't need to go on the road, stay home. The gentleman who is the promoter asked earlier about people behaving, etc. One of the reasons why I have deliberately taken a decision personally not to go to many places, and you know that I'm a hot-footer, but by the same token, I have, in the course of the last 9 to 10 months, significantly reduced where I go, who I see, and what I do. And why? Because I want to be here next year with you. I want to be here the year after, and I want you to be here with me. And if I want you to be here with me and I to be with you, then we can follow the basic rules together. It doesn't take anything off of us. I want to share a little story. There's a young boy, and I want to shout out to him. His name is Micah, and he lives in Cambridge, in St. Joseph. Dale, I'm not taking your young constituents from you, but he and I struck up a good relationship when I went into Cambridge. Yesterday was his birthday, and I sent him a Spider-Man cake. And he called his cousins, I'm told, and told the cousins, I have a birthday cake here. You can come and share it with me. But when you come, please bring your mask. Now, this is a 5-6-year-old boy who gets it. If he can get it, then each of us can get it. And I ask those of us who may feel that life is a happy-go-lucky thing, it isn't. Sometimes we have to pause and just step back. But all of us know that individually if we look in the mirror and ask the questions. I get it that some people were angry, I heard you, and we're listening to you. But by the same token, let us be fair and recognize that if we don't work together as a people, if we don't allow for the things and recognize that while COVID is the immediate menace, it is not the only threat facing this country. I repeated that a person died from dengue last week. A person has not died from COVID for months in this country. So we have to recall that we have a multiplicity of issues that we still have to face as a government and as a nation. But I'm confident, my people, I'm confident that Barbados and Barbadians have what it takes to get past this. If we have to keep talking to you, we will. Yesterday, it was regrettable that there was no press conference. It wasn't out of malice. It was out of the fact that everybody was under pressure, coming and going. And we have people who are working double shift back to back. So that, believe you me, I have given you the assurance in this country that whatever I know other than national security details, you will know as Barbadians. And as long as there's breath in my life, in my body, and as long as the members of cabinet that I have are with me because they share the same principles that I do on this matter of sharing. And let me remind you, when people have gotten in trouble in the past politically, it wasn't for the act of what they did that they were impeached. It was invariably for not sharing information. So we get it. And I have a very, very simple rule. Be transparent, be accountable, be empathetic, and literally be prepared to listen and to change course if necessary. If we do that as a government, and if you cooperate with us as a people, then I have every confidence that next year this time we will be reflecting on what we had to do to get through this moment. May God bless each and every one of you, and may God bless our country. Thank you.